Okay, first you know why it is need to study about the water. As you already know that 70% proportionate of our weight is present in the form of water in your body, and it is the chief constituents of body. It is presented in the blood as in the form of plasma. It is present in the form of cytoplasm, several cytosolic fluids, and there are so many biochemical reactions which are proceed in the presence of water. We call hydrolysis reactions. Okay? Hydrolysis is not a breakdown of water, it is a breakdown of substance in the presence of water. So there are so many reactions. That's why it is important to study about the water, how much water we take, how much water we output. So this topic is important. All of you studied this topic. Okay. So first we discuss about the body water. Body water, as you know, their waters are generally present in our blood, mainly in the circulatory system. It is helpful for transport of different constituent to particular organs, particular tissues, for provide nutrients and other things. So here's it important. Water is the chief constituents of human body. Water is the chief solvent of human body. Because how much water is present in our body, we can calculate by the weight of the body. We will assume that 70% of weight percentage is present in the form of water. Okay? (60 to 70% of total body weight is water, and we are not survive without water. We are not survive without water because there are so many things are depend on water. So water is a very important constituent. Okay. Now sources of water. This is exogenous sources. These are the sources of water. How we take water from different constituents, either in the dietary form or by directly intake of water by the drinking. Simply. Okay. It is intake of water. Output is in the form of urine. Okay. So water intake through the mouth is highly variable, 1 to 5 liters. This depends on social habits and climatic conditions. Now this is important to study because हमें क्या करना चाहिए? हमको अपने वाटर में, जिसको कहते हैं ना, किसी किसी लोगों में कहते हैं कि पानी की कमी आ गई है, देयर इज डेफिशिएंसी ऑफ वाटर इन देयर बॉडी. Either we take water by drinking, okay, but this drinking of water is depend on two main habits: social habits and climatic condition. Social habits and climatic condition. And these are the endogenous sources of water. Endogenous means inside the body, how the water is produced, how the water is formed. It is metabolic water, either 400 ml, that is required for metabolic processes, because there are so many metabolic pathways are occur in our body, like glycolysis, gluconeogenesis. It is a cellular process, but metabolism, central metabolic pathway, central metabolism is occur in the liver in presence of water. Okay. And produced during metabolic oxidation of food stuff. Now distribution of total water. Total body water. This is TW. Is total body water is distributed firstly in the form of intracellular fluids. ICF. Intracellular fluid. That is 65%. Plasma is 8%. and interstitial fluid is 25% and transcellular fluid is 2%. This is overall distribution of water inside the body. Okay? So question is comes like that. Comes question किस तरीके से आ सकता है? Question आएगा write about the distribution of water in the body. Write about the distribution of water in the body. So you will tell all this percentage. You will firstly mention that 70% of the body weight is present in the form of water. Then you will separate out in this format, that is intercellular fluid is 65%, plasma at 8%, interstitial fluid is 25%, and transcellular fluid is 2%. Okay, so this overall is distributions of water. Now, how much it is assumed? But मतलब कितना होना चाहिए? Total body water कितना होना चाहिए? 60 to 70%. That's mean 36 to 49 liters. Varies, depends on the weight. जिसका जैसा weight है उस पर depend करेगा. ठीक है? Intercellular fluids कितना? 65%. That is 35 liters. Intracellular fluids. Okay. Extracellular fluid is 14 liters. That is 35%. Plasma is 3 liter. Transcellular fluid is 2%. Interstitial tissue fluid is 11 liter. So these overall distributions of water with weight of 70 kg. With weight of 70 kg. It depends, it varies different conditions. Okay. आपका एक इसमें पॉइंट था, yes, water intake through mouth is variable 1 to 5 liter depend on social habit and climatic condition. What does it mean? Can you explain, anyone? Social habits, what is the meaning of social habits? What is climatic conditions? Climatic condition, listen. Some of the people are residing in a cold areas, like in the Jammu and Kashmir and some cold areas where they are not feel thirsty. If they are not feel more thirsty, the intake of water is variable. So it depends on climatic condition. If we talk about the people who are residing in Rajasthan, where temperature is more than 45 degrees Celsius. Okay, so to maintain the homeostatic temperature level of the body needs continuously water. So there is thirsty feeling appears in the body continuously, and the people take water intake. So it's depend on climatic condition. What is the meaning of social habits? Can we tell what is the meaning of social habits? If somebody people is alcoholic, they will take alcohol regularly. So what the alcohol do? Well, alcohol produces dehydration in the body. And if there is dehydration in the body, they needs water to accomplish this condition. Okay? If somebody is taking more tea or more coffee, so what happens? In excess amount, then there is frequent urination occur. Okay? In this condition, the patient, the subject, the people feel thirsty. It is a normal condition. Basically in disease condition, if there is anti-diuretic hormone, vasopressin hormone, both hormones are secreted differently, then there is water intake is different. So all things are depend on social habits and climatic condition. Now we'll see it is the total body water. That's it. Intercellular fluid is 63% and interstitial fluid is given by the percentage of the color. You will understand. same things. So this is overall water percentage of the body. In the newborn child, there is about 80% of weight intake is mainly present in the form of waters. Okay. In adults male, it is 60% and 50% in adult female. The percentage shows the water ratio in overall body weight. Okay. So these are the total body weight. 45% is solid, 55% is fluid, 50% is fluid, and 40% is solid. Solid means bioconstituent which you take like carbohydrate, proteins, and fats. Okay, and some muscular mass is dense, bones. All things are solid mass, and rest of the things are fluids. Okay, so these are given in this format. Body water content in percentage of a body weight is lowest in well-built men, fat women, well-nourished child, fat men. So all these are having less percentage of water. So these are some you noted in your copy. This point you will note it in your copy because sometimes question is asking you don't know how to write the answer. So this point will be helpful. When you read the topic, when you make a concise answer of particular question, this point is helpful. So don't skip, don't write, just write it the points. So the percent of the body is depend on the healthy build-up. First thing, fat content, obese people are not taking much. If they are contain more fats, there is percentage of water is less. Okay. So all these are the it is the questions. Now, what is the main function of body water? What is main function of body water? Because I will finish the topic today. So that's today we are going. Involvement biochemical reaction. Water acts as a reactant in biochemical many hydration, hydrolytic reactions of metabolic pathway. I already tell you in the first introductory speech that is the water is playing and accomplished for hydrolytic reactions. Hydrolytic. What is the meaning of hydrolysis? What is the meaning of glycolysis? Breakdown of carbohydrate is glycolysis. Okay, but not in the case of hydrolysis. Hydrolysis is breakdown of a substance in presence of water. This is called hydrolysis. Okay, so water acts as a reactant in many reactions. It complete hydrolytic reactions. Now, second point is transport media of the body. It transport nutrient and waste metabolic products. That is important because when there is urine formation in the body, they contain several metabolic waste product. Which waste product? You already performed the test. Test for urea, test for protein, test for uric acid, sodium, potassium. Many things are excreted out in the urine. That's mean it transport and waste metabolites through aqueous media to the blood and tissue fluids. It is excreted out in the form of urine. Okay? And it regulates the body temperature. It is a major point of water. What happened today's time? What happened in सर्दियों के टाइम पे क्या होता है और अभी क्या हो रहा है? अभी हम लोग जहां से जाएंगे, आप लोग लेक्चर हॉल तक जाएंगे, आपका स्वेटिंग होगा. स्वेटिंग किस लिए होता है? Why there is more sweating? To maintain the temperature of the body. Okay. If there is more sweating, there is deficit of water, आपका थ्रस्टी लेवल बढ़ेगा, हाइपोथैलेमस से एक सिग्नल जाएगा कि भैया पानी पीना चाहिए, तो आप लोग पानी पिएंगे. You maintain the level of the water to maintain the temperature of the body. So this is the function of the water. So there are three functions involved in biochemical reaction. First functions, transporting media of the body. Second functions, regulate body temperature. Third functions, now water transport hormones, enzymes, blood platelets, and red and white blood cell. Because the circulatory systems of the body contain water. Circulatory systems of the body contain water. So the major function of blood, it is major function of water. Same. Okay. Water acts as a solvent for electrolytes and non-electrolytes. You know the solutions chemistry. Solution what? There are solvent and solvents. Solvents and solutions. So the sodium, potassium are present in the blood. So it is present in the water directly. So water is act as a solvent. Water facilitates digestion and promoting elimination of indigested food. Water serves as a tissue lubricants because in our cellular compartment you will see there is a presence of mitochondria, there is a presence of nucleus, there is a presence of ribosomes. All these are surrounding with the cytosolic fluids, and these cytosolic fluids mainly contain water. Okay, so these are providing lubricant for such kind of microorganisms. Okay, so this is, and water facilitates digestion and promoting elimination of indigested food. By that, if there is some person having problem of incomplete indigestion and there is water intake is regularly, then this indigested food is excreted out in the form of stools. Okay, that's why if you are taking fibrous diet, if you are taking regularly fiber in your diet, they take this kind of foods and excrete out in the form in stools. All are by water. So all these are the important. All you will notice this point. This point is not given generally in your book. Okay. Yes. Now body water input and output. Body water input and output. How much water we take and how much water we excrete out. Just write it only the quantity, the points. So this is ingestion of liquid moist food. Sorry, 2300 ml, 2300 ml जो आपका जो पर डे इंजेक्शन ऑफ लिक्विड होता है और जो फूड्स के थ्रू हम लेते हैं वो कितनी क्वांटिटी हो गई 2300. ओके, और जो मेटाबॉलिक सिंथेसिस ऑफ वाटर ड्यूरिंग सेलुलर रेस्पिरेशंस, this is 200 ml per day, 200 ml per 24 hours. So there are two quantities. The first one is 2300 ml, which is by intake of drinks, intakes of food. Okay, and second one is endogenous formations of water, endogenous synthesis of water by cellular respiration process. It is 200 ml per day. So overall quantity is how much? 2500. Okay, it is input. Now body water output, you will write this point, body water output. So first you understand how the body output means how the body is excrete out this water in which by organ. By kidney it is 1500 ml per day in the form of urine, by urine formation. Evaporation from skin as in the form of sweating, that is 600 ml per day. Exhalation from lungs 300 ml per day, and fecal material 100 ml per day. So we will excrete out approximately, this is again 2500 ml per day water. How much we output? How much water is output present in our body? 2500. Excrete out कितना हो रहा है? 2500. Okay, in different forms. You will calculate it. 1500, 600, that is 2100 and 00, then 300, 2400, then 100 ml, 2500 ml per day is excrete out. This is water output. क्वेश्चन आ भी सकता है, नहीं भी आ सकता है, बट यू नो वेल कितना आउटपुट हो रहा है, कितना इनपुट हो रहा है. ठीक है. This is again diametric presentation, how much water we excrete out and how much water we take. अभी पॉइंट वो लिख लिया है, वो समझ में आ जाएगा, इससे कोई इशू नहीं. ठीक है. नाउ बॉडी इलेक्ट्रोलाइट्स, बॉडी इलेक्ट्रोलाइट्स. ओके. So now question is like comes in your university exam. Write about the distributions of water in our body and mention its importance as per biochemical aspects. As per biochemical aspects. Now, how will you give the answer of this question in your copy? किस तरीके से आंसर देंगे इसका? Tell me. How will you give the answer of this question if question is asking in the university exam? अभी लिखना है आपको, कैसे करेंगे? चार्ट बनाएंगे. First you write the 4 introductions of water distribution in the body. Then, okay, then you will make a separate percentage distributions of water. I already mentioned you. I already tell you how much distributed in the percentage form. Okay. Then you will give the biochemical aspects, biochemical importance point by point. I already give you. Okay. So इस तरीके से क्वेश्चन आएगा. It contain maximum carry 5 marks and you have to attend at least 2 pages of your university copy. Okay. अच्छी तरीके से हेडिंग सब हेडिंग की फॉर्म में देंगे तब आपको अच्छे नंबर मिलेंगे. ध्यान रखिएगा इस बात का. ठीक है. Now body electrolytes. What is electrolytes? Please, anybody can define what is electrolytes? नहीं पता? Substance when dissolved in solution dissociated into ions. Sodium, potassium, chlorides, all these are electrolytes. When it is dissolved in the solution, it dissociates into ions. Generally, we take this electrolyte in the form of ORS solution, oral rehydration solution. Where you take ORS in severe diarrhea condition, in excessive vomiting condition, where you lost electrolytes. But electrolyte is very important, very important. Okay. Now these are able to carry an electric current, and electrolyte is a substance which develop an electric charges when dissolved in water. This is the proper definition of electrolyte. When it is dissolved in the solutions, it carry a charge, either it is positive, either it is negative. Because you already know either it is going for oxidation, for reduction. This is different reactions like Na plus, K plus, Cl minus. So all these are what? These are electrolytes. If they are dissolved in a water and these can carry a charge, it is known as electrolyte. What is that? Electrolyte. Understand? Electrolyte is what? When electrolyte is dissolved in the water, it carry a charge. It is known as electrolyte. Okay. Now body electrolyte is NaCl, KCl in aqueous solution get dissociated charge into Na plus and Cl minus. It is called electrolyte. The concentration, it is generally expressed in milliequilibrium per liter. Milliequilibrium per liter. It is very important. It is, these electrolytes are very important. By arterial blood gas analysis, ABG machines, by different electrolyte machines, we can calculate this level of sodium and potassium. Okay? And it is related with the clinicals. We discuss one by one. Types of electrolyte, it is either cation or anion. I will not tell you what is cation. I will not tell you what is anion. You already know. Okay. Water molecule completely surrounded by these dissociated ions. These prevent union of cations and anions. Now, distributions. How much electrolyte is distributed in extracellular fluid? How much distributed in intracellular fluids? Okay. Now, intercellular fluid electrolytes, it contains potassium, magnesium and phosphorus. It is present in ICF. It is present in ICF. You already know about the bicarbonates because it is given in your Acid base balance. These given an acid base balance level of bicarbonates. Okay. Extracellular electrolytes contain sodium and chlorides. It contains sodium and chlorides. Okay. So if somebody is asking where is presence of potassium, it is present in intracellular fluids and sodium is present in extracellular fluids. You already know the different functions and we discussed. It is the neutrality is maintained means how it maintain the proper ion distributions. It is either by number of cation, number of anions in different compartment. Compartment you understand it is either we talk about ICF or ECF. It is present in intercellular fluids or extracellular fluids. Okay. Now this is the level you already know sodium is present in range is 140 milliequilibrium per liter. Milliequilibrium per liter. Okay. Chloride is 103 milliequilibrium per liter. Potassium, calcium, magnesium, this total cation is 155 milliequilibrium per liter. Please take the picture of this slide. Take picture of this slide. ये बुक ये स्लाइड ऐसी नहीं बनाई है कि आपने किसी बुक से बना दी है, बुक काफी स्टडीज करने बाद बनी है, ठीक है. सो the total anion is 155 milliequilibrium per liter. So what will you see? This is producing electrical neutrality. Why? The number of cation is equals to number of anions. So this makes electrical neutrality. Okay. Now this is some important cations and anions which is present in intracellular fluids. So sodium, potassium, calcium, magnesium, chlorides, sulfates. Okay, it is present in intercellular fluids. The level is 195 milliequilibrium per liter, 195 equilibrium per liter. So it maintains electrical neutrality again. So we are not something discussed here. You just keep in your mind these data. आपको ये आना चाहिए, इतना लेवल होता है कैटाइंस का, इतना लेवल होता है एनाइंस का. यू ऑलरेडी नो ऑल दिस लेवल्स. इसके लिए क्या करना पड़ेगा? इसको बार बार लिख के देखना पड़ेगा. ठीक है, बार बार लिखेंगे इसको रिटेन हो जाएगा दिमाग में, फिर आपको जरूरत नहीं है स्लाइड व्लाइड देखने की. ठीक है. So now this is all about the extra intercellular fluids present of sodium, potassium in extracellular fluid and intercellular fluids. So you will see sodium is present in higher amount in extracellular fluids. Extracellular fluids, and in intercellular fluids the level is too low. But in the case of potassium, it is present in high amounts in intracellular fluids, not in extracellular fluids. So by this graph we understand the relative concentration and ratio of different cation and anions. Okay. This is not too important to all of you, just you understand with this graph. Again, the distributions of electrolytes milliequilibrium per liter in blood plasma, interstitial fluid and intracellular fluid. You will take the picture of this slide. Okay. All of you take the picture of this slide. आराम से जब पढ़ो तब देख लेना इसको. ठीक है. ब्लड में 142 तक जा रहा है, यहाँ पे आपका सोडियम, पोटेशियम 4 तक जा रहा है, 5 तक कैल्शियम जा रहा है, 2 तक मैग्नीशियम जा रहा है. बट what is the level of calcium in the blood? Can you tell me the normal level of calcium? Anybody else? कौन बोला? हाँ बताओ. 10 to the power? It is 9 to 11 mg per dl. 9 to 11 mg per dl. This is the distribution of calcium in the body. Okay. So now function of body electrolytes. Can you? What is the function of body electrolytes? It maintain osmotic pressure. It maintain osmotic pressure. That is the main function of these electrolytes. Okay. And by the osmoregulation, what is maintained? The level of the water balance. Okay, osmotic pressure help in maintaining water balance. If there is osmotic pressure become disturbed, because for osmotic pressure, albumin protein is also required to maintain osmotic pressure. If this osmotic pressure is disturbed, what happens? There is edema occur. The water retain in the tissues, which produces swelling or inflammation of a particular organs. Okay, so this is to be called edema. Now, electrolytes, it is by the graph distribution, we understand that sodium is present in extracellular fluids and potassium. Why it is important? For normal membrane excitability and nerve impulse. What is the appropriate term for this? For muscular contraction and nerve conduction. For muscular conduction and nerve conductions, muscular contraction and nerve conduction, what is required? Potassium is required because it produces depolarization and repolarization reactions. Okay, physiology में आपने पढ़ा हुआ पूरा ये. Now chlorides, it regulate osmotic pressure and regulating acid-base balance. So all these electrolytes different functions, and it is important for maintaining different normal membrane excitability for nerve impulse, regulate osmotic pressure, and maintaining acid-base balance. Calcium promote nerve impulse and muscular contraction and relaxation. Okay, and magnesium are helpful because several enzymes are magnesium dependent for their functions. Okay, it's play in carbohydrate and protein metabolism, storage and use of intercellular energy, neural transmission, importance in functioning of the heart, nerve and muscles. Please take the picture of slide. Okay, यह आपको याद रहेगा बाद में. आपको बार बार बुक पलटने की जरूरत नहीं है उसमें, सीधे सीधे पॉइंट पढ़ते जाओ. Okay, how it is play a role in carbohydrate and protein metabolism? In the form of enzyme. There are several magnesium dependent enzymes. Okay, storage and use of intercellular energy, neural transmissions, all these are the function of magnesium. These are three electrolytes: sodium, potassium, chlorides, calcium, magnesium. Okay, all having different functions. अभी इसमें बोल दिया, ज्यादा पढ़ना है तो मिनरल चैप्टर को डिस्कस करो, क्योंकि यहाँ पे अपने क्या पढ़ना है बेसिकली वाटर एंड इलेक्ट्रोलाइट बैलेंस. वी आर नॉट गोइंग टू डिस्कस अबाउट द फंक्शन ऑफ these minerals. Okay, now movement of water and electrolytes. Diffusion, you already all of you know the diffusion. Already all of you know the diffusion. Last bench, पता है ना, डेंसिटी की बेसिस पे जो मूवमेंट होता है, either it is diffusion, effusion or osmosis. Okay, movement of particle down a concentration gradient. Osmosis, movement of water across a membrane from a less concentration solution to a more concentration solution. More concentration solution. It is osmosis, all of you know that, I know well. And osmolality, what is the number of moles per liter of a solution? It is called osmolality. And osmolality, the number of moles per kg of solvent. Number of moles of per kg of solvent is osmolality. We skip this point. ये भी पढ़ लो. ठीक है, यहाँ पे दो कंडीशन होती है, एक होती है हाइपोटोनिक, द सेकेंड वन इज hypertonic. Draws water from the compartment with lower osmotic pressure, it is called hypotonic. And the compartment with higher osmotic pressure, it is hypertonic. So to maintain the equilibrium, there is distributions and fluid movement either by different condition. Either it is from high pressure level to low pressure level. All these are osmoregulation, osmosis process. Okay. इसका आगे का नेक्स्ट क्लास में पढ़ेंगे, ठीक है? वैसे भी टाइम हो रहा है, बाद में पढ़ेंगे. So all things are water inputs, electrolyte balance. में जल्दी इसको देखता हूँ, उसमें क्या इंपॉर्टेंट है. ज़्यादा कुछ नहीं बचा है. फैक्टर रेगुलेटिंग वाटर एंड इलेक्ट्रोलाइट बैलेंस. कौन कौन से फैक्टर हैं? एक तो आपका वाटर एंड इलेक्ट्रोलाइट्स एक साथ में मेंटेन करते हैं. दूसरा है आपका ऑस्मोटिक इक्विलिब्रियम, जो इलेक्ट्रोलाइट्स के बेसिस पे बनता है, ठीक है. इलेक्ट्रोलाइट वाटर बैलेंस go hand to hand in human body. These are the points.
I explained the compensatory mechanisms by hypothalamus, how temperature is regulated in day to day, how it can be done by heat gaining, processes of heat gaining. Kekecilis, act doing. You know all, and rest of us very unlucky. Anyway, so this is very important for understanding for this class also, but lecture classes cannot be repeated at all. So in gist, there is a thermal control of our heat generations, heat gain, heat consumptions, all are important. Anything, any core temperature is very important because our core temperature is essential for the enzymatic activities and the metabolism, right? Core temperature ke amake fix rakhte hobe at a fixed temperature of কত degree? 97.7 বা 97.52 at least 90. এখন আবার বলছে কিছু কিছু বইতে 98.6, কিছু বলছে 99.5. Anyway, core temperature must be in this region of this range. That means 36.5 to 37 degrees centigrade. It is the core temperature essential for the temperature regulations and other metabolism of our system. Why it is important? Because each and every cell does their metabolism to reproduce the ATP energies. ATP নিয়ে আগের দিন অনেকগুলো কথা বলেছি, how the metabolism is come and how the heat gain is maneuvers, heat loss. আমার বাইরে খুব হিট, আমার বাইরে প্রচন্ড হিট. So our body temperature, the hypothalamus will detect that, so that heat losing mechanism will be fast. যাতে heat core temperature does not beyond that the extent, because if core temperature is much more high, then there is a problem of enzymes, and enzymes are essential for our different metabolism of each and every cells. তাহলে প্রত্যেকটা জিনিস, এই যে আমি হাঁটছি, কথা বলছি, আমার সেলুলার মেটাবলিজম হচ্ছে, and all the time heat is going on. আমার শরীরে সবারই শরীরে হিট তৈরি হতেই যাচ্ছে, because metabolism is on. So if metabolism is on, heat is producing. So to some extent it is believed that heat will be much more, but not that. Core temperature must be fixed. What does it mean? It temperature controls by the hypothalamus. তাই না? আগের দিন বলা হয়েছে anterior hypothalamus, posterior hypothalamus. These areas are some of cold sensitive, few are hot sensitive, but remember hot sensitivity is very high. পেরিফেরালি আমার সামনে যত ঠান্ডার জিনিস আছে বা গরমের জিনিস আছে, আমার বডি সব থেকে বেশি সেন্সিটিভ ইজ ফর দ্য হিট সেন্সিটিভ. নাও ইজ ভেরি কমন টার্ম ইজ এ ফিভার. হোয়াট ডু ইউ মিন বাই ফিভার? হোয়াট ডু ইউ মিন বাই ফিভার? এনিওয়ান? ফিভার বলতে কি বুঝিস? জ্বর, হ্যাঁ? ফিভার, ফিভারে আরো অনেকগুলো নাম আছে. কি কি? ফেব্রাইল আর পাইরেক্সিয়া. সেই জন্য প্যারাসিটামলকে বলা হয় অ্যান্টিপাইরেটিক ড্রাগস, ঠিক আছে? সো ফিভার মিনস ফেব্রাইল. ফিভার নেই, অ্যাফেব্রাইল. Most of the students and me, including me and the staffs, are afebrile now, right? Why it is afebrile now? Because there is our set point created by hypothalamus. So hypothalamus, suppose this is the brain and this is a part of the hypothalamus and this is a hypothalamus, and there a set point is there to maintain this temperature, to maintain that core temperature of our body. আমাদের বডিতে দু রকম ভাবে টেম্পারেচার হয়, একটা হচ্ছে ভেতরের কোর টেম্পারেচার। হোয়াট ডাজ ইট মিন? আগে ক্লাসে পড়ানো হয়েছে। It means the temperature surrounding the deep tissues, blood vessels, etc. And another is a cell temperature. আমার স্কিনে যেটা পাচ্ছি। So during the fever, you only recognize the peripheral temperature, but beyond that, core temperature also may rise. But whatever it may be, hypothalamus acts a bigger role to point a set point. Now, question is that why fever? Fever comes from কোত্থেকে? Infectious cause and non-infectious cause. Infectious cause means what? Bacteria, virus, fungal. Non-infectious cause is what? Autoimmune disease, injury, malignancy, etc. So these are the non-infectious sources of fever, causing of fever, and some infectious causes. Viral fever মনে করতো কোভিড হলো, বা একটা কমন কোল্ড অ্যাডিনোভাইরাস দিয়ে হলো, ইনফ্লুয়েঞ্জা ভাইরাস। So these are the viral causing your fever. What does it mean? কেন হচ্ছে fever? Fever expressed due to the presence of some sorts of endogenous pyrogens and exogenous pyrogens. Exogenous pyrogens. What do you mean by pyrogens? Pyro means what? Pyro means heat. Gen means generation. So heat generations particles are exogenous, and then another is a exo আছে মানে endo আছে, then endogenous pyrogens. So pyrogens is very important for causing your fever, and this pyrogen is responsible for increase our set point during the fever. আমি যখন নর্মাল আছি আমার সেট পয়েন্ট আছে একটা 98.6 সেট পয়েন্ট করে রেখেছে, কারণ হাইপোথ্যালামাস অ্যাক্টস লাইক এ থার্মোস্ট্যাট। এই যে এসি গুলো চলছে, একটা টেম্পারেচার আসার পর দ্য কম্প্রেসর উইল বি অফ। মনে করো সেট টেম্পারেচার করে দেওয়া আছে, দেখ তো কত দেওয়া আছে, কত দেওয়া আছে 16। So if whenever this temperature of all the corners is 16, then it will shut off. কে করছে এটা? ভেতরে থার্মোস্ট্যাট আছে, কম্প্রেসরের ভিতর থার্মোস্ট্যাট আছে, সে রিড করছে যে কত টেম্পারেচার। ঠিক আমাদের শরীরে hypothalamus is a reader. It acts like a thermostat, and when our temperature is fixed 16 degree, ও ওটাকে সেট করছে, is setting. But during the fever, due to the exogenous and endogenous pyrogens for different causes of infectious cause and non-infectious cause, the set point is not fixed. তখন কি করছে? ও সেট পয়েন্টটাকে বাড়িয়ে রাখছে। The set point is increasing. কোথায় বাড়িয়ে রাখলো? মনে করো 102 এ বাড়িয়ে রাখলো। 102 কি ফাইনাইট বলছে। And then when you're recording your axilla or in oral, you are taking as a temperature as like আমার জ্বর স্যার 101 জ্বর 102 জ্বর। Most of the cases core temperatures can be detected by rectal temperature. Remember, oral temperature is 0.6 less than the rectal temperature, but it's not so easy to take the rectal temperature, so we taking the oral temperature. But base temperature is the lower part of the esophagus. That is not easy, it is invasive. So whenever you are want to get the proper ideal exact temperature of core temperature of our body, then you have to go the lower part of the esophagus. Anyway, so fever means is productions of exogenous and endogenous. Exo means কি? বাইরে। বাইরের কি কি আছে? মনে করো একটা ব্যাকটেরিয়া আছে, ব্যাকটেরিয়া মেবি গ্রাম নেগেটিভ, মেবি গ্রাম পজিটিভ। Gram negative bacteria are producing the endotoxins due to the presence of lipopolysaccharides. So it is a gram negative bacteria and is a gram positive bacteria. This is a bacteria, right? So gram negative bacteria ki ache na lipopolysaccharide ache, and these are producing the endotoxins, and these are the producing the exotoxin. So these toxins produces from the bacteria are basically exogenous. ভেতরে গিয়ে কাজ করছে, but they are coming from outside. And what does mean the endogenous? Endogenous means our bodyতেই তৈরি হচ্ছে. What are those? Those are the different cytokines. Cytokines. কেন cytokines করতে গেলো? ইমিউনিটি পড়ার সময় বলেছিলাম, ইমিউনিটি আমি পড়েছিলাম. So already you know better that any bacteria or viral, our immune system, non-specific immune systems like the neutrophil, macrophages are come into action to play to kill the bacteria or any organism invading in our body. আমার বডিতে একটা ব্যাকটেরিয়া ঢুকে গেল, অত সহজ নয় সে তার যার মতো করবে, because our defense system is there. First of all, our defense system, 3-tier defense system is there. মিউকাস মেমব্রেন আছে, স্কিন আছে, সেটাও যদি পেরিয়ে যায়, দেন ডিফেন্স সেকেন্ড আমাদের ডিফেন্স সিস্টেম হচ্ছে ইমিউনিটি, অ্যান্ড দ্য সেলস আর দ্য নিউট্রোফিলস mostly, and then recognize it is a foreigner has come, and so it will try to kill. During the killing process, cytokines are released. Most cytokines responsible for or endogenous pathogen responsible for our fever is interleukin 1 and interleukin 6, TNF alpha and interferons. These are the cytokines or endogenous pyrogens responsible for our fever. তারগুলোর মধ্যে সবথেকে মোস্ট ইম্পর্টেন্ট হচ্ছে interleukin 1 and TNF alpha. It is strong cytokines responsible for the productions of or responsible for our fever. During the immunity chapter, I already told you that fever is not at all a problem. If any patients come to me, আজকেও এসছে সকালে, একটা ভোরবেলায়, কালকেও এসছে with fever, high fever, I am very much pleased. I am very much pleased, and you should be, because fever manifestation means your defense system is correct. So your body immunity is functioning properly. At the level of high temperature, suppose একটা পেশেন্টের 99 ডিগ্রি ফারেনহাইট, সেটাকে যদি জ্বর এখন বলে না, ideally it is not fever. Remember, 100.4 degree Fahrenheit is nowadays in our climate is a fever. More than that is fever. If anybody is telling in your relative that's my 99.9 অনেক জ্বর, এটাও অনেকে বলে 99.9 বিশাল জ্বর চলে এসছে. Not at all. He is suffering from malaise due to some immune response or some pyrogens, because these pyrogens or the cytokines is released in the muscles also. So that's causing the myalgia, joint pain. So etc. This is causing due to this endogenous pyrogens. So 100.4 degree Fahrenheit, আমি এখন বাচ্চার মাদের বলি 100 বেশি না হলে কোনো ওষুধ দেওয়ার কোনো দরকার নাই. Even if it is 102 and child is playing, don't give any paracetamol, because at the level of 102 degree Fahrenheit, our immune system or that child's immune system at the top notch, সে সেখানে ডিফেন্স সিস্টেমকে খুব ভালোভাবে কাজ করাচ্ছে. Non-specific and both the specific, even T cell memory, B cell memory, is the activity is much more higher at the level of more than 102 degree Fahrenheit, etc. Not fixed at all, not anywhere written that which temperature is a perfect for the immune response. But you remember that any time kinds of fever, any patients is a good thing. Is a good thing now, because you have to identify the cause of fever. Most of the fever are viral fever. Most of the phases is recover within the 5 to 7 days. If it is much more and any focus you are seeing that some abscess is there, some sorts of tonsillitis, tonsillar abscess is there, some joint abscess is there, a liver abscess is there, that is different, and is a bacterial or amoebic or maybe fungal. But remember this, any fever is a good thing. It's a good thing, because the patient's having fever means his defense system is correct, and he will be recovered within oneself. আমাদেরকে অনেকেই আননেসেসারি আমাদেরকে ফিস দিয়ে যায় ফর দ্য ফিভার. একদিন যদি কোনো বাচ্চার 103 জ্বর আসে, সে আমাদের কাছে আসবেই আসবে. দ্যাট ইজ এ ব্রেড এন্ড বাটার. বাট আই নেভার প্রেসক্রাইব লাস্ট ফর 1 মান্থ. আমার মনে পড়ছে না একটাও পেশেন্টের আই হ্যাভ গিভেন অ্যান্টিবায়োটিক্স. Not at all. Not a single call have come. Only they are sending the temperature chart of every day at 9 p.m. It is my protocol is there. All the hours, 4 hourly temperature gradations is very important, because before the 4 hour antibiotic does not act. মারা কি করে? মিনিটে দেখছে 101, 102, আরে বাড়বেই তো, সেট পয়েন্ট তো বেড়ে আছে. So whenever your set point is increasing due to the pyrogens, different types of infections, maybe bacterial, তার bacterial হতেই পারে, হতে দাও, কোনো অসুবিধা নেই. After the 5 days, we will conclude that yes, there is something is problem. So you have a hand investigation is there. There is a CBC and CRP. CRP always will be high in any fever because any infections, C-reactive protein will be high. But in case of viral fever, neutrophil count will be less, that is leukopenia and relative lymphocytosis. Exception is adenovirus. In case of adenovirus, কয়েকদিন আগে একটা দেখলাম পেশেন্টের লিউকোসাইটস কাউন্ট আর 17,000, CRP is 54, but the features are like adenovirus. Remember that only adenovirus which does not cause leukopenia, it is causing the leukocytosis. That is an important clue, is a clinical lab diagnosis or clinical correlations of the adenovirus may present as a leukocytosis. It does not mean আমি 17,000 দেখলাম নিয়ে আমি ওকে অ্যান্টিবায়োটিক চালিয়ে দিলাম, কেন দিলাম না? কারণ ইন দ্যাট কেস রিলেটিভলি লিম্ফোসাইটোসিস হয়েছে, বোঝা গেছে, লিউকোসাইটের সঙ্গে লিম্ফোসাইটোসিস হচ্ছে, that's more prone to be viral, and that is the adenovirus, and always correlate with the clinical scenario or clinical history. This is very much important. Fever হচ্ছে তোদের bread and butter হবে. Fever is your bread and butter. Each and every patient, each and every day you can get will come with a patient with fever. Fever may come with a infectious cause, that is a viral, bacterial, fungal, protozoal, anything can come. But as well as a non-infectious cause, especially in female, that is autoimmune disease. আমার কাছে একজন কয়েকদিন না কয়েক মাস আগে বেসিক্যালি মেয়ে এলো যে তার ফিভার হয় আর যায়, হয় যায়. He is suffering from 6 months with slapped cheek rash appearance into the cheek. Butterfly rash is going on into this. ওয়েস্টিল বোধহয় জামতারা, মানে চিত্তরঞ্জনের দিকে যে জামতারা আছে. The patient has come. This is important clue or dermatological sign of patient may suffering of SLE, systemic lupus erythematosus, and I do the all investigation, all are positive. So this is called autoimmune cause of fever. The patient is coming with joint pain and the rashes of slap cheek, like the butterfly rash is a characteristic finding of SLE, mostly present in the female. So I diagnosed the case and I want not to look after because so much medications, follow-up was needed. That's not my time, my job. It's a rheumatological transformations is gone and transferred to the higher center after my diagnosis. Anyway, so this fever will be your bread and butter. If you understand fever, if you understand the causes of fever, if you understand the pathogenesis of fever, that will be grateful to your patients and to you. You will never miss the fever. Fever is very much horrid. খুব তারা বিরক্ত হবে পেশেন্টরা, জ্বর কেন কমছে না. If you don't show confidence to your near relative of your patients, then you may lose the patient. You may lose the patients. So if need, you have to understand, you have to explain the pathogenesis. More or less, I explained very often as mother and parents what is fever. Daily বলে যাচ্ছি আমি এটা. Even I write down the prescriptions to some of extents of hypothalamus and then pyrogens, and then they come to knowledge and then search the internet, Googles, etc. Oh yeah, fever is good. So they will not never let you go. তোকে ছেড়ে যাবে না, তুই অ্যান্টিবায়োটিক দিচ্ছিস না বলে তোকে ছেড়ে যেতে পারে, গিয়েওছে ইনফ্যাক্ট আমাদের কাছে যায় অনেকে, স্পেশালি দোজ আর জেভিয়ার্স স্কুলে যারা পড়ে, মনে করেন দুর্গাপুরে কার্মেলস আছে, যারা দুর্গাপুরে তারা জানে. So those are child are coming from Xavier's, Carmel, is huge academic pressure is there. So mothers and parents want sir antibiotic দিয়ে দিন প্রথম দিনেই. So I never give. I always give, if you want to antibiotics, please search for another doctor. There are 44 doctors at the Durgapur now. Rampantly antibiotics 1 and 2 and 3 giving. And if you don't understand the pathogenesis fever and knowledge of greater knowledge, you will definitely write after passing out, did একটা antibiotic দিতে তো বাবা এই পেশেন্ট যদি পালিয়ে যায়. So that is the important clue. That is the important things. Whenever I will get the prescriptions from you, then I will laugh. So what is these classes? Failure to take home message of this class is that any fever is good thing. I am very much pleased. If fever does not there, you can't understand the diagnosis. Any fever, maximum fever subsided within the 5 to 7 days. Most of these are viral fever. Even COVID also. Even COVID also, we have tried lots of. I have come into the 2 times of the second wave, first wave and third wave. Second wave luckily escaped. So anyway, any COVID infections or any COVID fever is always good because of that the cytokines. But COVID a problem যেটা ছিল, that is a cytokine storm. That means hyper immune response. That means ভাইরাসটা এমনই একটা ভাইরাস ছিল, ইমিউন রেসপন্সটাকে একটা লেভেলের মধ্যে রাখতে পারছে না. He is giving hyper response. Anything any high is bad. Your confidence is good. Overconfidence is bad. For treating any patients or treating or giving answers to your examiner also. If examiner see your confidence is good. If it is overconfidence, that is a detrimental for that day. That is not good. ঠিক এরকমই immune system is at the level of at the innate immunity, at the non-specific immunity is good. But if it is going beyond that, hyperimmune response, and that is means our host cell acts as a foreign. মানে আমাদের তখন নিজেদের সেলগুলোকে সে ভাবছে বেটা একেই খাই, একেই খাবো না একেই খাবো, যাকে পাচ্ছি তাকে খাচ্ছি. So that is called cytokine storm, and that was the dangerous in the second wave. That strain was not good enough because the cytokine storm at that strain was can lose many of our doctors, many of our senior citizens. We lost many things, and all the countries have suffered for that because of cytokine storm, and that's why the term was that using steroid use and proper using of steroids. I'm coming why steroid is important for the fever also. So this fever is nothing but a maybe non-infectious or infectious. If you are not beyond the non-infectious cause, is not so much uncommon. That's autoimmune disease, cancer, even your cerebral hemorrhage or brain hemorrhage or pontine hemorrhage may cause hyperpyrexia. At a point say hemorrhage, I have seen only one patient during my internship. There's a pontine hemorrhage, extensive fever is there, 106 degree Fahrenheit was there. Only presentation was fever, but ultimately it was diagnosed as a pontine hemorrhage. This is a test book, it's written in your book also. But I have seen, I'm lucky, this pontine hemorrhage is there, and there's a pons hemorrhage, that means pons এর যত cranial nerve ছিল all are in disturbed ছিল. So that's why pons এর মধ্যে disturb এর মধ্যে একটা আগেই বলেছিলাম 6 cranial nerve, যারা ক্লাস করেছিস আমার, you know already 6 cranial nerve means abduction nerve is there. So that patients were lateral rectus palsy was there. So that is an important clue, and we do go for the MRI, directly MRI, and that shows the pontine hemorrhage is there, and the different cause was the hypertension. So it is recovered, surgery was done, and then recovered, and fever was subsided. So non-infectious always you make trouble. Infectious cause is very easy. Bacteria আছে, আমি এটা ফোকাস পাচ্ছি, আমি এটা অ্যাবসেন্স পাচ্ছি, is very easy to diagnosis and management. Whenever you are in microbiology, always think which kind of bacteria, which kind of virus, which kind of antibiotics must be given. আমার হয়েছে একটা নাম গ্রাম নেগেটিভ, আমি গ্রাম পজিটিভ কভারেজের অ্যান্টিবায়োটিক্স দিচ্ছি, ভালো হবে না. So that's the issue. And so that this microbiology class in second year classes in your seniors, I don't know what is their status. Always try to diagnosis and to understand why we should know. Why we should know, we should understand about these pathogens, it's the negative, positive. It is important for pharmacology also. So correlate. Always whenever you are going to be second year, third year, always try to correlate. Whenever you are doing a correlations between these all the things, then you at the final year, even after the passing your exam and intensive and exit exam also, you will be a complete, a good clinician only doing MBBS. Only MBBS. Only MBBS means? What does it mean? শুধুমাত্র MBBS করেছি, আরে MBBS করে দেখা না ভালো করে. So many অনেকেই আছে এখনো পর্যন্ত শুধু MBBS করে, lots of knowledge are there. And কলকাতাতে এরকম ICU আছে যারা only মাত্র ICU critical care maintains by only the MBBS because of their good skill, good knowledge, identification, consultant কে আসতেই হয় না. I have seen. many RMOs was very fixed. আমি জানি ও আছে মানে ও সব ঠিক আছে. So that's the great. You have to extend to come knowledge and learn and take off message from every section of the lecture. So these things are endogenous and exogenous. Pyrogens is responsible. These pyrogens, pyro means heat, gens means generations. So heat generating substance are there endo and exo. Exo means coming outside, endo means is inside. And so inside pyrogens means cytokines and interleukin 1, TNF alpha, tissue necrotic factor. টিস্যু নেক্রোটিস বলে, নেক্রোটিক বলে, টিস্যু নেক্রোসিসি বল, টিস্যু নেক্রোসিস ফ্যাক্টর আলফা, ইন্টারফেরন আবার গামা, আলফা, ডেল্টা অনেক কিছু আছে, জাস্ট ইন্টারফেরন কামিং, and these interferons or cytokines are pyrogens of endogenous, and that increasing the set point of this set point of hypothalamus is increased. এই সেট পয়েন্টটাকে বাড়িয়ে দেয়, আর কিছু করে না. So whenever it is happening, set point কে বাড়লে কি হবে? কে বাড়াচ্ছে set point? Pyrogens বাড়াচ্ছে? Not directly. কি সেটা? The pyrogen increases the circulating level of prostaglandins, PG, prostaglandins, and specifically that is PGE2. It is formed by the cyclooxygenase enzyme. I'm not going into details, this is a pharmacological chapter. So PGE2. So these pyrogens will increase the level of PGE2 in the circulation as well as in the hypothalamus. In the hypothalamus, there is a specific area that is called preoptic area. That is called preoptic area of the hypothalamus. Preoptic area hypothalamus causing the circulating levels of PGE2 levels are increased, and this increased PGE2 is main responsible for the increase the set point during the fever, right? So whenever you are giving antipyretics or NSAIDs, what do you mean by NSAIDs? Non-steroidal anti-inflammatory drugs. Okay, very good. So these drugs like aspirin, like acetaminophen, that is paracetamol, these are the NSAIDs, and these NSAIDs are key inhibitors of this PGE2 ke কমিয়ে দেবে, and if it is less, then set point will be less. So set point will be reduced. Set point ke বাড়তে দেবে না. So that's why fever will subside after the giving the paracetamol. The paracetamol খেলাম আর কমে যাবে. অনেক লোকে তোকে বলবে প্যারাসিটামল খাচ্ছি স্যার 2 ঘন্টা, আমাকে ফোন করে 2 ঘন্টা হয়ে গেল স্যার এখনো কমেনি, 103 ছিল 103ই আছে, তো থাকবে, because cyclooxygenase enzyme is not inhibited so much. Threshold of individual heat transformations is different from you and you. আমার থেকে তোর থেকে আলাদা, একটা বাচ্চা একটা বড় তার আলাদা. Threshold of picking up heat or threshold for the set point is different. I'm not going details, it is a very big thing. Anyway, that's কারো ফিভার 1 ঘন্টাতেও কমতে পারে, কারো ফিভার 4 ঘন্টাতেও কমতে পারে, কমে আবার বাড়তেও পারে, because pyrogens are there. যত লোড অফ ভাইরাল ব্যাকটেরিয়াল লোড তত বেশি ফিভার আর তত বেশি প্যারাসিটামল না দেওয়া ভালো. কেন? কারণ at the level of high temperature, immune system has a peak level to kill the microorganism. তাহলে যখন ও মারছে, রেপ্লিকেশন হোক যেইভাবেই হোক, যখন proliferation হচ্ছে ব্যাকটেরিয়া বা ফাঙ্গাল বা এসের, then they are killing at that high temperature. So if we give less amount of paracetamol or not frequently, then what will happen? The body will kill much more bacteria, so that the duration of illness will be much shorter. It's very, I have seen many patients. I have seen many lakh patients দেখেছি আমি. Whenever you are dealing on mothers is not allowed, after my কি বলবো lecture of fever, mothers also বুঝেছে যে হ্যাঁ জ্বর এলে জীবনটাকে মারছে তাহলে থাক, ও যখন খেলছে তাহলে দেবো না. আমার নিজের ছেলে যেমন 103 জ্বরেতেও দেখেছি খেলে বেড়ায়, একটা বাচ্চা আবার 101-এতেই দেখেছি শুয়ে পড়ে. So the kids who are playing at the 103 fever, don't give paracetamol. His or her illness duration will be less, because we are not giving paracetamol, so killing of bacteria or fungal, whatever it may be, is doing fast, and so the proliferation level will be low. খুব তাড়াতাড়ি লেভেলটা কমে যাবে. But if you are giving the paracetamol and set point is changing, So the immune response or immune power করার যে ক্ষমতা, it will be less. So the proliferation will be much more. তাহলে আবার ভাঙছে, আবার মারছে, আবার খাচ্ছে, and these things are stretching of the duration of illness. যেটা 3 দিনে কমে যেত সেটা 7 দিন লাগলো, যে 7 দিনে কমে যেত সেটা সেটা 10 দিন লাগলো. In this way, even whenever there is no need of antibiotic and you are prescribing the 2 to 3 antibiotics, you are puzzled, জ্বর কমছে না, 5 দিন হয়ে 6 দিন হয়ে গেছে, পেশেন্ট এবার ভেঙে যাবে. You are giving what? We are changing the antibiotics. It is a very bad practice in nowadays. Very bad practice from juniors as well as to some extent seniors also. Whenever you are dealing in 7 day, 9, 8 day fever, then you are FOMO, fear of কি পেশেন্ট ভেঙে যাবে. They okay to touch antibiotic. Gram negative, gram positive, anaerobic coverage you are giving. You are giving, but fever is not subsiding. Because it is causing another antibiotic associated fever. So many patients I have cured only the stopping of antibiotic, and I am the boss. Antibiotic বন্ধ করেছি 15 দিন ধরে জ্বর, 15 দিন ধরে 10 রকমের অ্যান্টিবায়োটিক খেয়েছি, ইনজেকশন নিয়েছে, ওরাল অ্যান্টিবায়োটিক আমার কাছে এসছে, আমি বললাম যখন জ্বর অ্যান্টিবায়োটিকে কমছেই না, সো হোয়াই শুড উই গিভ, তাহলে আমি এটা দেবই কেন? লেটস ডায়াগনোস ফার্স্ট. যেই জ্বর অ্যান্টিবায়োটিক্স বন্ধ, উইদিন 36 আওয়ার জ্বরের প্রবণতা বন্ধ. সো হোয়াট ইজ হ্যাপেনিং হিয়ার? ইট ইজ হ্যাপেনিং ফর দ্য অ্যান্টিবায়োটিক অ্যাসোসিয়েটেড ফিভার. 15 দিন ধরে ভুগছে, 2 দিনে জ্বর জ্বর ভালো হয়ে গেল, যেই ভালো হয়ে গেল সে বলছে ছাড়ুন ছাড়ুন, এবার ছাড়ুন, বিল বাড়ছে. বুঝতে পারছিস জিনিসটা? So these things are very much essential to understand what is fever, what is the main pathology behind this fever, and what is your target. Yes, if it is uneasy, if it is patient having some history of febrile convulsion, remember 1 to 5 years of age in the children, it may come as a, if it is 100 or 102 in the peak fever, then that is called febrile convulsion. যেটাকে আমরা বলি বাংলা ভাষায় তরকা. Febrile convulsion মানে কিছু নিয়ে হবে, febrile convulsion. So if it is any history or any happens, then you have to treat these early phases of fever. তাহলে আমি তাকে 100-101 যেতে দেবো না, স্পঞ্জিং করাবো and bath করাবো. And again remember, without giving any antibiotic or antibiotic দেওয়ার উদ্দেশ্য কি না PGE2 কে কমাবো. PGE2 কে কমানোর উদ্দেশ্য কি না প্রি-অপটিক এরিয়া হাইপোথ্যালামাসের সেট পয়েন্টটা দেবো কমিয়ে, বা ওকে বাড়তে দেবো না হাইপোথ্যালামাস. This is a target. Whatever it may be, if you bath with your fever 102, 103, just shower নিন, just shower নিন, it will decrease 1 to 2 degree within half an hour. This is very fast. It is a heat mechanism. But whenever you are pyrotics, then sweating will come. Why? Because hypothalamus is active. Your thermoregulations mechanism is active. So this activeness causing the sweating to heat loss. I already described heat loss. Heat loss process, one of the important is what? Sweating, right? And heat conserve is, heat production is shivering. During the fever, shivering is very common. কেন কি না, all the vessels of this is a vasoconstricted and maximum blood will go into centrally, হার্টে চলে যাবে. ওর এখন hyperdynamic circulation বেরোচ্ছে, হার্ট রেট বেড়েছে, হার্ট বেশি করে পাম্প করবে. So these are happening and the periphery will be cold. অনেক বাবা মা বলে ফোন করে, স্যার হাত পা ঠান্ডা হয়ে গেছে, জ্বর হয়েছে কিন্তু হাত পা ঠান্ডা হয়ে গেছে, তারা ভাবছে যে এখনই মরে যাবে. দে ফিল দে উইল ডাই বিকজ মরে গেলে হাত পা ঠান্ডা হয়. ইটস ভেরি ন্যাচারাল. আমি বললাম খুব ভালো তো, জ্বর হয়েছে তো ঠিক আছে, ওগুলো বডি নিজে কারেক্ট করছে. সিভারিং হচ্ছে, বাবা মা আচ্ছা করে কম্বল দিচ্ছে. হোয়াট ইজ হ্যাপেনিং হিয়ার? নট গুড অ্যাট অল. ইফ ইট হিট ইন ইউর বডি, দেন লেটস দ্য রেডিয়েশনস ফার্স্ট. Already in the previous class, I explained the radiation, evaporations, and the convections, and also the conductions process. I explained in the previous class very nicely. So whenever you have fever, then the temperature is going on, and the temperature is high, and then your environment, then your heat will be radiated from your body to the environment. But if you are running in the 42 degree, then the radiation will to effect of opposite side. The heat will gain by your body. The radiation will be in both ways, right? So radiation is not always in the heat illnesses. So fever add to this, I am not going details into this. So PGE2, set point, pyrogens, interleukin 1, interleukin 6, TNF alpha, interferons, endogenous pyrogens, exogenous pyrogens, Preoptic area of hypothalamus set point is increased, is important for your exam. So how the mechanism of this happens is all about the your fever, and fever is your bread and butter. Remember this. Always accept any patient with fever. Fever means that may be non-infectious or may be infectious. So you have to rule out. Most of the fever is mostly viral, and this viral all automatically is subsided within 5 to 7 days. If not that, do a preliminary investigations of CVC, CRP, and then the clinical parameters also. If any fever without focus means what? আমি দেখতে পাচ্ছি ওটার জন্য ওটা হয়েছে, আমি দেখতে পাচ্ছি এখানে একটা অ্যাবসেস আছে, that fever is different, and that antibiotics should be started in the first day. But before that, we should not start antibiotic at least before 5 days. Remember that. Anyway, now there's the heat illnesses, right? Hot. This is a very hot topic. Hot and humid is very important for this one. Hot, not only hot, that is hot as well as humidity. Humidity is important to carry forward the hot illnesses or hot weather illnesses. There are 4 or 5, if I not remember, 4 or 5 things are there. One is heat syncope বলে আবার, nowadays it's called heat syncope, right? Or heat cramps is very common. In the 2 to 3 days my wife was suffered for this heat cramps. I'm telling what I have done so far. And then heat exhaustions, HAUS, exhaustion, and then heat stroke. This is very important for your exam also. And then malignant hyperthermia, malignant hyperthermia. So what are those? Heat syncope is a hot temperature. Suppose you are doing exercise or running in the hot or humid temperature. So what will happen? Body আমার কি করবে? বডিতে বেশি হিট করা যাবে না, কোর টেম্পারেচার ইজ ফিক্সড, সো বডি উইল কম্পেনসেট কি হবে? by sweating. So in this case I am coming here, so increase sweating. If it increase sweating, then কি হবে? What will happen? Volume depletion. Volume of blood, volume of plasma will be decreasing. Then if sweating is there, if sweating increases and heat must be lost. Heat loss হওয়া দরকার, কি হবে করবে? Vasodilatation of skin. তাহলে কি করবে? Vasodilatation. তাহলে another is a vasodilatation. And vasodilatation means peripheral resistance কমবে না বাড়বে? কমবে. So again peripheral resistance will decrease. If peripheral resistance decrease, then peripheral resistance is directly proportional to the which pressure? Diastolic pressure. Remember that. Peripheral resistance is directly proportional to the diastolic blood pressure. So diastolic BP fall. এই বন্ধ থাক. Then it is volume is decreasing. If volume is decreasing means venous return কমে না বাড়বে? venous return কমে না বাড়বে? কমবে. কার্ডিয়াক আউটপুট কমে না বাড়বে? কি কমে যাবে. So ultimately it will calm the systemic blood pressure ও কমে যাবে. তো systemic blood pressure, diastolic blood pressure দুটোই কমে যাচ্ছে during the heat syncope and then collapse. Then patient will collapse. So this is called heat syncope. It's very easy. খুব কঠিন নয়, but first class was very important for you. Sweating, number 1, vasodilatation is for the compensating mechanism is going on by our neurothermal regulations by hypothalamus. যখনই দেখবে সে প্রচুর হিটের মধ্যে আছে, বডিতে বাইরে প্রচুর হিট আসছে, সেন্সরি এখান থেকে যাবে রিসেপ্টরস and go into center, and then effector will come. Effector will come as a sweating and vasodilatation. If sweating is there, volume will be less, venous will be less, cardiac will be less, heart rate will be high, because is BP is low, then the baroreceptor will be stimulated. Baroreceptor stimulated, heart rate will be high. So heart rate will be high. Anyway, heart rate high. লিখেও দিলাম যা. So what is happening? Vasodilation, peripheral resistance less, peripheral resistance directly proportional to anywhere, any cardiovascular system. This peripheral resistance দিয়ে প্রচুর answer পাবি করতে। If you know the single sentence, the peripheral resistance is directly proportional to the diastolic blood pressure. So diastolic blood pressure is less, হয়ে গেল systolic blood pressure less, and then ultimately patient will come as a collapse. পড়ে গেল। So that is called heat syncope. Now what do you mean by heat cramps? What do you mean by heat cramps? Heat cramps মানে muscle cramp. Right though? Muscle cramp means electrolytes problems. Electrolytes, here they are. Heat cramps এ কি হবে? Again, sweating is going on. Again, sweating is going on. Sweating হচ্ছে। And another thing here it happens, sweating in hot and humid, that is sodium ion will be depleted. Sodium ion will be depletions. Sweat দিয়ে বেরিয়ে যাচ্ছে in unacclimatized person. আমি অনেকক্ষণ ধরে আছি, আমার সোয়েট গ্ল্যান্ড থেকে সোডিয়াম বেরোবে কম, কিন্তু আমি কিছুক্ষণ আগেই বেরোলাম, বেরিয়ে আমি এক্সরসাইজ করছি, ছুটছি, এই বাস ধরতে যাচ্ছি, এখানে আমার কাজ আছে, তাড়াতাড়ি ছুটতে যাচ্ছি। সো আই এম নট অ্যাক্লিমেটাইজড at all. So these unacclimatized persons having this many loss of sodium ion, right? So dehydration will be there. হবে তো? When dehydration will be there and volume will be less, আগেকার মতোই সোয়েটিং হয়েছে, ভলিউম হবে লেস, কি হবে না, থ্রাস্টি হবে, প্রচুর জল খেয়ে নেবে। আমার মিসেস যেটা করেছে, প্রচুর ইয়ে হয়েছে, এক্সস্টন হয়েছে, and then she drink lots of water. What is it meaning? Sodium is less, you are giving more water in your body, dilution is much more, you are not giving salt, salt is less. So what is happening? Hypotonicity, and the sodium, if we drink much more due to this dehydration without input of salt, then muscle cramp obviously it will happen. আমি মিসেসকে বললাম একটু কোনো দোকান থেকে নুন নাও, নুন খেলে ওই নুন চিনি বা নুন দিয়ে একটু জল খেয়ে নাও, that will be helpful and rest at cool places, and that is recovered within half an hour. So that is called heat cramps. It's very common in your family members. So what is your suggestions for your family members? Yes, if you want to drink, so drink ORS, nole ডাবের জল, because sodium is there. Because sodium already is less, you are giving water much more, then what will happen? Dilution. Sodium দিচ্ছি না, জল দিচ্ছি, so that will decrease much more, আরো sodium কমিয়ে দেবে concentration, and that causing the muscle cramp. That causes the muscle cramp. Number 3 is a heat exertion. What do you mean by heat exertion? Heat exertion again into two types. One is water depletion and another is salt. একটাতে জল কমে যাবে, আরেকটাকে সল্ট কমে যাবে। এই ওয়াটার ডিপ্লেশনকে বলা হয় আইসোটোনিক হিট এক্সারশন, and এটাকে বলা হয় হাইপোটোনিক হিট এক্সরশনস। তাহলে হিট এক্সরশন মানে হচ্ছে জাস্ট হিট স্ট্রোকের আগে, বাট রিমেম্বার হোয়াট এভার ইট মে বি, হিট cramps, heat syncope, heat exertion, your body has two regulatory system is there intact. One is CNS function is intact, and your thermoregulator system or thermoregulation is intact. But in case of heat stroke, both of two are lost. দুটোই চলে যাবে। That is a dangerous and medical emergency. That is a heat stroke. আমার যদি বডি টেম্পারেচার বেড়ে যায় আর আমার বডি যদি বুঝতে না পারে, তার থেকে বেশি খারাপ আর কিছু হতে পারে না। And these patients will come as a dehydration. Any dehydration may come with a nausea, malaise, will come, vomiting, abdominal pain. সল্টের জন্য কি হবে? সল্টের জন্য হবে যেটা একটু আগে বললাম, হিট ক্র্যাম্পস, মাসল ক্র্যাম্পস, as well as suppose this is your extracellular fluid and this is intercellular fluid. Here is hypotonia, hypotonicity, hypertonicity. Fluid তাহলে কোন দিকে যাবে? Fluid will go in this way, right? So what will happen? Cerebral edema. So cerebral edema may happen in case of his observations. Cerebral edema. Heat stroke হয়. Cerebral edema in early phases come as a incoordinations, improper judgment, confusions may start. বোঝা যাচ্ছে? So this may happen as cerebral edema. Is not good. Is not good at all. Right? So in these cases, these are up to this maintainable. ঠিক আছে, কিন্তু কেন মেনটেন করছি? কারণ আমার হাইপোথ্যালামাস কাজ করছে, আমার সিএনএস ফাংশনস এখনো পর্যন্ত আছে, নার্ভ ড্যামেজ হয়নি। নাও when your core temperature is above 41.5 or 105 degrees Fahrenheit, then the heat stroke happens. Then your heat stroke happens when your core temperature is either 41.56 যাই বল, more than 106, কোনো বই লেখা আছে 107, বেসিক্যালি 107 এ পেশেন্টের ডেথ হয়ে যাওয়ার সম্ভাবনা খুব হাই থাকে বিকজ অফ ডিফারেন্ট কজ। আই এম কামিং লেটার ইজ টাইম পারমিটস today or anyway if classes permitted about this. So heat stroke is more than this, and সবচেয়ে ইম্পর্টেন্ট জিনিস হচ্ছে loss of thermoregulation, number 1, and cerebral or CNS dysfunctions. তাহলে CNS dysfunctions হবে, আর কি হবে বললাম যে no regulations, thermoregulations, no thermoregulations, no thermoregulation, মানে hypothalamus আর কিছু বুঝতে পারছে না। If hypothalamus does not understand the outer heat, then he or she, hypothalamus maybe he, maybe she, that cannot recognize is a heat loss করবে না heat gain করবে না কি করবে। Whatever you are sweating or shivering is happened due to your hypothalamus. It's happening there. Up to this is your present. But these patients is calm, is a catastrophe. Medical emergency. Presentations কি হবে? হিট বেড়ে গেছে। কি হবে? ওইগুলো তো যা যা হিট এক্সপোজার হয় ওগুলো সবগুলোই হবে। প্লাস কি হবে? এখানে হার্ট রেট বাড়বে, হিট এক্সপোজারে হার্ট রেট বাড়বে, বিপি কমবে। বিপি কেন কমবে? ইউ অলরেডি নো। এখানে একটা জিনিস হবে না, সেটা হচ্ছে সোয়েটিং। সোয়েটিং হবে না। নো সোয়েটিং। কেন? সোয়েটিং কে করাচ্ছিল? Hypothalamus. No regulation, no roll off. So here heat stroke, remember that is বড় করে লিখে দিচ্ছি, no sweating. So any patient will come without any sweating, but with skin is a red, dry and hot. Is more probably landed into heat stroke. Without any sweating, the skin is red, dry and hot. And this such core temperature is like that, and so the no sweating is there, so the patient has landed already into heat stroke. আর কি হতে পারে? মাল্টি অর্গান dysfunctions. How? This is the heat means denaturation of the proteins, and proteins are formed in liver, so hepatic failure is common, renal failure is common. How renal failure is common? Because of muscle protein breakdown, that is called rhabdomyolysis. Rhabdo means striated, myo means muscle, striated muscle, lysis মানে breakdown. তাহলে rhabdomyolysis হিট স্ট্রোকে হবে। কিভাবে হয় এটা জানা আছে? rhabdomyolysis টাইম আছে? rhabdomyolysis জন্য যেটা হয় সেটা হচ্ছে recurrent contraction of the muscles, repeated contraction of the muscle. How? Contraction হওয়ার জন্য কি দরকার? ক্যালসিয়াম। ক্যালসিয়াম থাকে কোথায়? সার্কোপ্লাজম রেটিকুলাম। রেটিকুলাম থেকে সাইটোপ্লাজমে আসে, তবেই মাসল কন্ট্রাকশন হয়। সার্কোপ্লাজম রেটিকুলামকে বেরোতে কি হেল্প করে? ক্যালসিয়াম। রায়ানোডিন রিসেপ্টর জানা আছে এগুলো? না ভুলে গেছিস সব? হ্যাঁ, রায়ানোডিন receptors are there. Ryanodine receptors inability to control or regulate the calcium from the sarcoma reticulum to cytoplasm in case of heat. তাহলে কি হবে, ও রেগুলেট করতে পারছে না, ম্যাক্সিমাম কার্বন ডাইঅক্সাইড ক্যালসিয়াম উইল কাম আউট from the sarcoplasmic reticulum to the cytoplasm and then causing the repeated contraction and that causing the rhabdomyolysis. And if it is happens, myoglobin will release from the muscles. Myoglobinuria, alloguria, oliguria, it happens. Creatine level high, that means what? Renal failure. So in this case, liver gelo, kidney gelo. যাক, কোনো অসুবিধা নেই। নাও each and every cell, one important protein is heat shock protein. নাম মনে আছে? নাম শুনেছিস না শুনিস না? যা মনে আছে কেউ শুনিস না, আজকে গিয়ে তাহলে হোম টাস্ক। Heat shock proteins are cells or protein is helpful, but when heat is very high, so this protein will act like a hyper immune response এর মতো কাজ করবে, and then invite inflammatory response will come. Inflammatory response will come. So this will come as a inflammatory mediators like cytokines. Different mediators will come. And then what will happen? Vasodilatation as well as permeability of the vessel. তাহলে পারমেবিলিটি অফ দ্য ভেসেল যদি বেড়ে যায়, এমনিতেই ওর এখন ডিহাইড্রেশন হয়ে বসে আছে, মানে একটা ভেসেলের মধ্যে জল এমনিতেই কম, এবার পারমেবিলিটি বেড়ে গেছে, মানে আরো জল আউট হচ্ছে। তাহলে আরো জল যদি বেরোয় তাহলে কি হবে? বিপি ফল করবে। সো বিপি উইল ফল সিভিয়ারলি, বিপি উইল ফল অ্যান্ড cardiovascular collapse may happen. বোঝা যাচ্ছে? So that may come as an asystole of the patients of heat stroke. So all are related. Again, another thing happens in case of heat stroke, that is these inflammatory mediators এত কিছু বেরোচ্ছে, mediators will attack endothelium, vascular endothelium. তাহলে smoothness of the vascular endothelium will be lost. হবে তো? If smoothness of the vascular endothelium is lost, then কি হবে? coagulopathy, coagulation cascade কে ইনপুট করবে, and that causing the DIC, that is disseminated intravascular coagulations. বোঝা যাচ্ছে? ক্লাসে ভালো করে শুনলে এগুলো মুখস্থ করতে হয় না। These are related, একদম পুরোপুরি ভাবে all the systems are coming. So multi organ dysfunction syndrome is coming on MODS. Ultimately patient যদি ভালো করে ট্রিট করা না যায়, তাহলে that will come into the MODS and death. So that is a medical emergency of heat stroke. And these coming how? Protein denaturations, this is due to high heat, liver failure, rhabdomyolysis, renal failure, and then inflammatory mediators are coming as a heat shock protein. Heat shock proteins are present in each and every cells, and these proteins are helpful many ways, many functions are there. You read it, it's a biochemistry. And heat shock protein, if it is much more heat is there, so over enthusiastic overactivity is causing the inflammatory mediators, and these mediators increase the permeability of the blood vessel and leaking the water, and so BP will be low, and then circulatory collapse, cardiovascular collapse will be there. And then again these mediators will attack the vascular endothelial cells. Vascular endothelial cells will be attacked, and these vascular endothelial cells will be attacked, the smoothness of the vascular endothelium will be lost. If it is lost, then you know already the platelet aggregation, platelet adhesions will be come on, and then the coagulopathy will happen. So this is called DIC, disseminated intravascular coagulations, and that is dangerous, that is venous thrombosis will be come on. So these things are coagulation pathway. So ultimately what will happen in heat stroke? The heat directly can also damage the endothelial layer. Heat directly can damage also CNS fibers, that is nerve fibers also can be damaged. তাহলে কি হয়ে গেল? সবই হয়ে গেল, নার্ভ গেল, টিস্যু গেল, লিভার গেল, মাসেল গেল, কিডনি গেল, ভেসেলস গেল ইন হিট স্ট্রোক। বোঝা যাচ্ছে? একটা হিট কিভাবে কন্ট্রোল করতে পারলো না, কেন পারলো না? ডিউ টু ল্যাক অফ টু থিংস, that is the thermoregulatory control is gone and CNS dysfunctions. These two happens after the heat exhaustions. Remember this all throughout your life. It's very important. You can say many things in your relatives also. Heat cramps is very common in your family. If you ask, whatever you will see, you will see your mother sometimes in your home also. She also can say that his mother বলছে যে পাটা একটু ক্র্যাম্প হচ্ছে কেন হচ্ছে the mothers are always rounding over your for your food, for your dress, for your is very tough job. Is a being a mother and basically housewife is very tough job and toughest job I think. And so you can advise that you please drink with some salt water. Because whenever you are salty depressions and you are taking fluids for your thirsty or dehydration due to the osmoreceptor or osmoregulations activity, but this will call dilutional hyponatremia. And this dilutional hyponatremia is exceptionally bad for the muscles cramps. It is responsible for that. Okay, so malignant hyperthermia কি জিনিস সেটা হচ্ছে রাইনোডিন রিসেপ্টরের মিউটেশন হয় আর ডিটেলসে গেলাম না that is called ryanodine receptor that is present in the sarcoplasmic reticulum and then this will call mutation that is called malignant hyperthermia and so this is almost same features of the heat stroke, right? Now few things here come to the note as the cold injuries. Cold injuries এর মধ্যে কি আছে? Hypothermia already I described in the previous class, but still some sorts of frostbite is very important for your exam also. Frostbite is written in your book. And also some sorts of pernio. What do you mean by pernio? Pernio is called the chilblain. It may come as your chilblains. Chilblains is come as a pernio, is come as a sword note. So these are the cold injuries. Mostly frostbite is very much not good enough. It has 3 steps are there. It has 3 steps. First is called frost nip. NIP nip, and then superficial, and then deep. So these deeps of frostbite is dangerous and medical emergency because it can cause amputation of your fingers. Frostbite কোথায় কোথায় হতে পারে অনেকক্ষণ ধরে একটা তুই হিমালয়তে পড়ে আছিস বা তুই 0 পয়েন্টে পড়ে আছিস without any cover at all and then it will come as a frost nip. Frost nip penetration will be just like pale a red like fingers toes, ear lobules, tip of the nose, cheek, chins, mostly involved. These areas are for the frostbite. Fingers, toes, tip of the nose, earlobes, and your cheek and chins. And this will come in the first stage. যদি এখান থেকে আমরা যদি অ্যালার্ট না হয়, it come to the superficial. How does it happen? It happening due to the crystal formation, ice crystal formation in the subcutaneous tissue. The স্কিনের তলায় তোর crystal formation হয়ে যায়, crystal. Ice crystal হয়ে যাবে এতটাই ঠান্ডা so this will superficial and then deep means what it involves muscle and joint and if deep is happen then the gangrene will very fast gangrene why because thrombosis happens how it is happen because if it is crystal clear a crystallizations of ice in the subcutaneous tissue then the tissue যে cell সেই cell এ আর অক্সিজেন যাবে না what will happen will be internal dehydration সেল থেকে জল বেরিয়ে এটাকে বলা হয় osmotic push and then this will come as a intercellular death. If cellular death is there, blood vessel will be compromised. How? Because of the coagulation pathway of thrombosis or coagulation thrombosis will happen in the blood circulation supplied to the tips etc. So blood circulation will be compromised and then gangrene will happen and then amputation is invariably otherwise যদি এখানে না কাটিস তাহলে এখানে কাটতে হবে না এখানে কাটতে হবে না এখানে কাটতে হবে এখানে কাটতে হবে that will progressive. So this third stage is the deep frostbite is dangerous. Before that frost nip you may come across the sword note as a frost nip NIP frostbite and frost nip. Frost nip is a part of the frostbite is the first part is a grade 1 so frostbite is not at all is a good thing. Chilblains is not very much medical emergency. It is basically a blister-like formations of the skin. It may happen in hand, rates in open areas in your some experienced also for 0 point. It is called pernio and chilblains. Itching will be there. The main symptom is that itching will be there, and then purpuric type rashes will be there, and so blister may form. Frostbite blister may form in the deep stage. Deep stage means what? Deep stage means muscles and joints are involving. পুরো অ্যাম্পুটেশন করতে হতে পারে এবং এটা হয় বিদেশে এটা প্রায় এভরি ইমার্জেন্সি যে সেন্টার্স আছে দে আর ভেরি মাচ এক্সপার্ট ফর দ্যাট। ট্রিটমেন্ট কি? আই এম নট গোয়িং ডিটেলস ট্রিটমেন্ট হচ্ছে ভেরি স্লো হিটিং। এমন নয় যে গেলাম আমার একদম ঘষে টসে আমি তাড়াতাড়ি চলে এলাম, দ্যাট ইজ নট ইজি। ফ্রস্ট বাইটের ক্ষেত্রে আর একটা ডেঞ্জারাস জিনিস হচ্ছে রিপারফিউশন ড্যামেজ। বাইরে গিয়ে পড়ে রিপারফিউশন ড্যামেজ। আমার পারফিউশন ছিল না ডিউ টু দ্য ড্যামেজ অফ দ্য ব্লাড ভেসেল, আমি আচ্ছা করে হিটে গিয়ে মানে আমি গরম জলে দিয়ে দিলাম, দেন দ্য ব্লাড ভেসেলস উইল কাম ওপেন হয়ে গেল, ব্লাড ভেসেল চলে গেল, দেন ইট উইল কাম ইজ এ ডেঞ্জারাস, that is called reperfusion damage. So that is not advised at all. Either you have to come at hospital and around 1 hour, basically 1 to 2 or 2-3 hours ধরে আমার 1 ডিগ্রি 2 ডিগ্রি করে আস্তে আস্তে করে হিটকে বাড়াতে হয়। So this is important. বোঝা গেল? আজকে ক্লাসে কি বুঝলি আমি জানি না, but these things are very important for your exam and result viva. Those things are not wanted. You go through the books, it's very easy. Cold injuries is normally not asked in the, except the frostbite is very important. Is the stages already discussed. Heat exhaustion, heat stroke is very important for your exam and your viva also. So go through these chapters in good books, good journals, good lectures, and if any doubt is there, careful. So heat cramps is a take-home message from this is heat cramps and fever. Fever we can give paracetamol and as well as we can give steroids to reduce the cytokines.
Which are the boundaries of orbital cavity or the eyeball? So who will tell how many bones it is taking part to making the orbital cavity? So it has got how many? It is a quadrangular in structure. Okay, so write it down. First one is the roof, okay, or the superior wall. Write it down, superior wall. So superior wall is formed by, how the superior wall is formed? Completely by the frontal bone, but you have to know which part of frontal bone. কোন part frontal bone এর? কোন part বল? ফ্রন্টাল বোনের কোন পার্টটা দিয়ে তৈরি হচ্ছে? অরবিটাল what? Orbital plate of frontal bone. Okay, so superior boundary is by the orbital plate of frontal bone. Okay, so now coming to the lateral wall. So how does the lateral wall is formed? Here is a formation of one suture. So this suture is known as কি বলে এই সুচারটাকে? Frontozygomatic suture. So here are the articulation of two bone. Which are they? Superiorly কে আছে? Frontal bone. Inferiorly is the zygomatic bone. Okay. Now which process? এই প্রসেসটাকে কি বলবো? Zygomatic process of frontal bone and frontal process of zygomatic bone. Write it down. Lateral wall is formed by, you have to be very specific. Okay. This question is frequently asked on viva. Orbital cavity boundaries. Okay, so lateral wall is formed by the zygomatic process of frontal, and another one is the frontal process of zygomatic. Okay, and the suture, এই suture কি suture? Which type of suture it is? Means which type of joint it is, tell me? It is a fibrous type of joint, okay, over here. And one peculiar thing is there is one tubercle, so that is known as, write it down, very much important, that is known as Whitnall's tubercle. Which one is Whitnall's tubercle? How you will get this tubercle? You have to just see the inferior surface of zygomatic bone. Okay, so here see, here is the situation of one tubercle. Okay, যেখানে frontozygomatic suture পেয়েছিস just below. Okay, you have to palpate on the inferior aspect, on the interior side. So there is a situation of Whitnall's tubercle. Tell me which muscle is attached over there? Whitnall's tubercle কোন muscle attached হয়? Very good. It is the lateral rectus. Okay, lateral rectus এখানে attached হবে. Okay, now coming to the inferior wall. Write it down, inferior wall. So how does the inferior wall is formed? Which bones? Inferior wall টা কি বোন ফর্ম করছে বল? Which process? Frontal process হবে কেন? ম্যাক্সিলার কি প্রসেস ওটা? এইটা তো ফ্রন্টাল প্রসেস তাই না, যেটা নোজে যাচ্ছে। সো এইটা যেটা অরবিটাল ফ্লোর তৈরি করছে, দ্যাট ইজ নোন অ্যাজ হুইচ পার্ট? হুইচ পার্ট অফ ম্যাক্সিলা? Orbital surface of maxilla. Okay, because eyeball is present over here. Okay, so this is the orbital surface of maxilla, the total inferior wall. Okay, now coming the most important, that is the lateral wall হয়ে গেল, superior wall হলো, inferior wall হলো. Now coming most important one, that is known as medial wall. Okay, now who will tell how many bones are there? Medial wall এ how many bones are there? Which are the bones? So if you go from medial to lateral, which are the bone? এই প্রথমে এই সাইডে কি বোন পাবে? First bone. First bone is the lacrimal. Okay, first bone is the lacrimal. Lacrimal is included in nasal bone, right? I told you 9 bones are there in the nose. কি কি ছিল? দুটো lacrimal, দুটো palatine, দুটো nasal, দুটো inferior nasal concha, একটা ভূমর. Okay, total 9 bones. So lacrimal are found over here on the medial surface of nose and the eyeball. Okay, so next যে বোনটা দেখ এখানে you could not find it out, it is already broken. Why? This is very much important. Next বোনটাই পাবো, write it down. It is the orbital plate of ethmoid. Orbital plate of ethmoid, and it is also known as lamina papriosa. Eta, because this bone is like a paper thin. Okay, you could not find, it is already broken. Okay, let me check this side also, it is broken. Okay, could you imagine how much thin it is? Okay, পুরো এরকম একটা স্কোয়ার শেপ বোন থাকে. Okay, so that is known as lamina papriosa. Write it down. It is a paper thin like structure. Okay, very vulnerable. So this is the ethmoid. Okay, orbital plate of ethmoid. So if you go more laterally, which part you will get? আর কি বোন পাবি? Medial wall. What about the palatine? Remember, which bone is a very small particle, but it will take part in orbital cavity. That is nothing but the palatine. Okay, now write it down. ethmoid এর পরেই কে থাকবে? palatine. Where? Over here. Okay, toward the center, যেখানে superior orbital fissure আর inferior orbital fissure meet করছে, there you will get the palatine. Okay, so it's a most smallest fragment of bone. ঠিক আছে, so that is the palatine. Now next one is medial wall. আর কে তৈরি করে? It is sphenoid, but which part? Greater wing of sphenoid. Greater wing of sphenoid. ঠিক আছে, তাহলে orbital boundary is clear for you. Now the next thing is, write it down, how many structure you will get over here in this eye cavity. Number 1 is superior orbital fissure. Okay, which one is a superior orbital fissure? কোনটা বলতো? Which one is a superior orbital fissure? Medially placed থাকবে, right? And see, it is going where? Towards the lateral side. Medial থেকে lateral side. Inferior orbital fissure টা কেমন থাকবে? Medial to the lateral side. It will go superiorly, it will go inferiorly. Okay, now how the superior orbital fissure has been formed, I have already told you. How it is formed? Superior orbital fissure টা কি করে তৈরি হয়? Is it a two different bone that is making the fissure or a single bone? It is a single bone. Okay, এটা কিন্তু MCQ আসতে পারে. Fissure on a single bone, of a two part of a single bone. Okay, so that is nothing but the sphenoid. Okay, superior orbital fissure is present on the sphenoid. Okay, how it is produced? It is produced by above is the lesser wing of sphenoid, and below is the greater wing of sphenoid. Okay, and you know the superior orbital fissure is divided into how many compartments? It is divided into how many compartments? Tell me. It is divided into 3 compartments. Okay, by K divide kore, which is the structure? K divide kore. Ball. Have you heard about common tendinous ring of Zinn? Okay, so all the recti muscle has got common origin. ঠিক আছে, যেমন আমরা ধর ফোর আর্মে কি পেয়েছি? কমন ফ্লেক্সার অরিজিন, কমন এক্সটেন্সার অরিজিন। এখানে কি পেলাম? কমন টেন্ডিনিয়াস অরিজিন অফ জিন। ওকে, সো ইট উইল সেপারেট, রাইট ইট ডাউন, দ্য কমন টেন্ডিনিয়াস রিং অফ জিন is dividing the superior orbital fissure into 3 compartments. Okay, so most medial compartment e ki thakbe? Most medial compartment, very good, inferior ophthalmic vein. Ophthalmic vein কতগুলো থাকে? 2. ophthalmic artery কটা থাকে? একটা। so only inferior ophthalmic vein is the content of the medial compartment. ঠিক আছে, then intermediate compartment এ কি কি থাকবে? কটা ডিভিশন অকুলোমোটরের? দুটো ডিভিশন, সুপিরিয়র ডিভিশন এন্ড ইনফিরিয়র ডিভিশন। রাইট ইট ডাউন, দ্য মিডিয়াল ইন্টারমিডিয়েট কম্পার্টমেন্ট। মিডিয়াল কম্পার্টমেন্টে শুধুমাত্র ইনফিরিয়র অপথ্যালমিক ভেন, এই চারটা কিন্তু ইউ হ্যাভ টু গো থ্রু। ওকে, so intermediate compartment, first one is superior and inferior division of oculomotor nerve. Next one is nasociliary nerve, which is a branch of, who will tell? nasociliary ta kar branch? bol, kar branch? trigeminal এর কোন ব্রাঞ্চটা? ophthalmic এর ব্রাঞ্চ। ওকে, ophthalmic branch of the trigeminal, nasociliary, ophthalmic branch of trigeminal. Okay, then last one is the abducent. Okay, how do you remember? 3 and 6. Okay, 3 and 6, ঠিক আছে, এটা হচ্ছে intermediate compartment. Now next one is the lateral compartment. Lateral compartment is, first one is the, এখানে মেমোনি কি আছে? LFT. First L is the lacrimal. Lacrimal again is a branch of ophthalmic division of trigeminal. V1, ঠিক আছে, ophthalmic division of trigeminal. ophthalmic nerve এর কি কাজ? আই বলে? এই জিনিসটা কিন্তু পুরোপুরি ক্লিয়ার হবে। অপথ্যালমিক ডিভিশনের কি কাজ? আই বলে? because vision has been taken up by the optic nerve, right? all the muscle has been supplied by 3 nerve. number 1 is oculomotor, then abducent, then another one is trochlear. Okay, so ophthalmic nerve is doing which work over there? sensory innervation of eyeball has been taken up by the ophthalmic nerve. ঠিক আছে, তাহলে ফার্স্ট নার্ভটা কি এলো? ল্যাক্রিমাল। দেন F for frontal nerve. frontal nerve again it's a branch of ophthalmic division of trigeminal. তাহলে কটা ডিভিশন আছে? 3টে। ঠিক আছে, একটা হচ্ছে তো ল্যাক্রিমাল, ফ্রন্টাল, nasociliary। ওকে, অ্যান্ড দ্য লাস্ট ওয়ান ইজ দ্য ট্রক্লিয়ার নার্ভ। এর সাথে আর কিছু থাকে? superior ophthalmic vein. Okay, superior ophthalmic vein. What about the ophthalmic artery then? Which foramen does it pass? It will pass through the optic canal. Okay, it will pass through the optic canal. এটা তো তোর গেল superior orbital fissure. Now next one is the inferior orbital fissure. Inferior orbital fissure. So tell me, how does it produced? Inferior orbital fissure is not produced in one bone, two separate bone. Which are the two bone? এইটা হচ্ছে inferior orbital fissure, তাই তো? তাহলে এটা কি করে তৈরি হলো? How does it produced? superiorly কে থাকবে? greater wing of sphenoid থাকবে আর part of palatine. Okay, part of palatine. Greater wing of sphenoid and the part of palatine. Okay, and below orbital surface of maxilla. Below is the orbital surface of maxilla. So which thing does it transmit? কি ট্রান্সমিট করছে? Infraorbital nerve and vessels. Infraorbital nerve and vessels. Okay, আর এখানে আর কি কি foramen পাবে? There is one foramen. This one, what is this? Supraorbital foramen, not fissure. Okay, supraorbital foramen. How does it produced? মিডিয়ালি থাকে না ল্যাটারালি থাকে? মিডিয়ালি থাকে। তাহলে কি বলবি এটা? ল্যাটারাল 2/3 and medial 1/3. ওকে, রাইট ইট ডাউন। it is found below the এই আর্চটাকে কি বলবি? এই আর্চটাকে কি বলে? nasociliary arch, superciliary arch, supraciliary arch. Okay, so it is found between lateral 2/3 and medial 1/3. Usually কিন্তু সব সময় আমরা কি পড়েছি? medial 2/3, lateral 1/3, তাই না? এটা জাস্ট অপোজিট আছে। সো which thing does it transmit? কি কি ট্রান্সমিট করবে? এটা কি ট্রান্সমিট করে? supraorbital nerve and vessels. Okay, it will transmit supraorbital nerve and vessels. And what is this structure? এটাকে কি বলে? glabella. Okay, between the superciliary arch, this portion is known as glabella. Glabella is clinically important. There is one thing is known as glabellar tap. What is that? We are persistently pressing over the glabella for a persistent period. Okay, what will happen? The pupil would be fixed, but if it is not fixed till it is dilated, that means in case of Parkinsonism. Okay, so there this glabellar tap is positive. ঠিক আছে, কিছু কিছু ডিজিজে করা হয় CNS এ, ঠিক আছে। So this is the glabella. What are the other foramen you will get? Write it down. Optic canal. So where you will get the optic canal? Could you see over here? এখানে দেখতে পাচ্ছিস this foramen, okay, which is connecting to the cranial cavity. So that is known as optic canal. কিন্তু MCQ আসে, optic canal is connecting which cranial cavity? With the eyeball. Anyone? optic canal টা কোথায় গিয়ে ওপেন করবে? Correct, it will open on the middle cranial fossa. এটা কিন্তু বারবার MCQ আসে, ঠিক আছে। optic canal will open into the middle cranial fossa because you have seen the optic chiasma, right? Also the sella turcica of the pituitary. Okay, so there is the opening of the optic canal. Now which thing is covering the optic canal? Write it down. Optic canal is covered with which meninges? Endosteal layer of meninges. Optic canal is covered by endosteal layer of meninges. It will transmit, last bench. It will transmit, write it down, it will transmit the optic nerve with meninges along with ophthalmic artery, So এখানে একটা কোয়েশ্চেন আসে, টেল মি হুইচ আর দ্য পিকুলারিটিস অফ অপটিক নার্ভ, ভীষণ ইম্পর্টেন্ট। ওকে, হুইচ আর দ্য পিকুলারিটিস অফ অপটিক নার্ভ। Okay, so this is about the optic canal. আর কি পাবি? What is this? Just below to this eyeball, here you are having another foramen that is known as infraorbital foramen. Write it down. There is the situation of infraorbital foramen. What does it transmit? It will transmit again infraorbital nerve and vessels. Tell me, it is a division of supraorbital nerve is a branch of কার ব্রাঞ্চ এটা, যেটা supratrochlear foramen দিয়ে বের হলো, so it is a branch of কার ব্রাঞ্চ, it's a branch of ophthalmic division of trigeminal. What about the infraorbital? Infraorbital is a branch of maxillary division of trigeminal, Okay, so these all things you will get in the eyeball. Okay, another thing is this eye has got one apex and one base. Okay, so could you tell me where is the apex and which is the base of eyeball? If you see the eyeball from outside, so this is the base. Okay, so base means this whole boundary, this four wall, it is making the base. What about the apex? Where it is going to the optic canal. ঠিক আছে, where it meets to the optic canal. So apex is formed by which bone? Optic canal বলছি তো, তো it is formed by which bones? কি কি বোন দিয়ে তৈরি হবে বল? See over here, এইটা তাই তো। So this is formed by, একটা হচ্ছে তোর ethmoid, orbital plate of ethmoid, আর একটা হচ্ছে তোর greater wing of sphenoid, Okay, and which are the other structure you could see in the eyeball? Over this area on the superior surface there is one trochlea. Okay, so which muscle is attached over here on the superior wall? Write it down. On the superior wall, superior or frontal wall, superomedially there is situation of one trochlea, Which muscle is attached with that? কোন মাসেলটা জানিস? It is the superior oblique. Okay, it is the superior oblique. ঠিক আছে, তার মানে এখানে পেলি Whitnall's tubercle, এখানে পাবে trochlea. Both are bony projection on the eyeball. Okay, so what are the other thing? Let's discuss. First one is, here it is written about the different nerves. Okay, write it down. Which are the nerve of eyeball? Nerve of eyeball, already you know. First one is the superior and inferior division of oculomotor. Okay, superior and inferior division of oculomotor. Second one is optic. Optic is the nerve for sight or vision. Okay, Then other one is trochlear, abducent and ophthalmic. Already told you. Write it down. The ganglion for eyeball. Ganglion for eyeball is which ganglion? Ciliary ganglion. Okay, ciliary ganglion. So what is the action of ciliary ganglion then? কি function বল ciliary ganglion এর? সেন্সরি ফাংশন গুলোকে রিলে করা। আর মেইন ফাংশন কি সিলিয়ারি গ্যাংলিয়নের? টিয়ারিং, তাই না? টিয়ারিং। it is actually acting on the lacrimal gland. Okay, it is acting on the lacrimal gland. আর already vessels I have discussed. Ophthalmic artery একটা আছে which is going through the optic canal and another one is known as the gland, that is the lacrimal gland. Now tell me, what is the location of lacrimal gland? Where you got the lacrimal gland? You have already dissected the face, right? Where you got? On the superolateral surface. Okay, superolateral surface of eyeball, there is situation of lacrimal gland. Okay, what are the other thing? Where is the, write it down, where is the situation of lacrimal fossa? Lacrimal fossa টা কোথায় থাকে? Lacrimal fossa is situated, see over here, lacrimal fossa is situated on the medial side. Okay, because what is the thing that are located on the lacrimal fossa? That is the lacrimal sac. Lacrimal gland থেকে কি হবে? Tear would be secreted, then where it is going? To the this conjunctiva, okay, this canaliculi, then where it is going? To the lacrimal sac, then finally it is draining to the nasolacrimal duct. Okay, opening into the inferior meatus. Okay, then see this one, these relations are very much important. So what they have shown, this is nothing but the superior orbital fissure. Okay, so what are the thing you could see? Eta ki first one is, this is the medial compartment, first one is inferior ophthalmic vein. Okay, and what is this? This is a common tendinous ring of Zinn, যেটাতে কিনা চারটে রেকটাস অরিজিন নিচ্ছে, ঠিক আছে? So what are the other thing? This is the medial compartment. So you could see these are the upper and the lower division of oculomotor, nasociliary and abducent, and these three are the lacrimal, frontal and the trochlear. Okay, এটা কিন্তু ভীষণ important. Superior orbital fissure, I have told you many times, so many question used to come. Okay, short note ও আসতে পারে, long question ও আসতে পারে। Now boundaries, write it down. Walls already I have discussed. Write it down. The apex. The apex is directed behind and formed by the body of sphenoid. Okay, how the apex is formed? By the body of sphenoid. It is formed by the center of the bony bridge between the optic canal and the superior orbital fissure. So it is between দুটো structure, medially কি আছে? Superior orbital fissure, আর laterally কি আছে? Optic canal. In between that, body of sphenoid. ঠিক আছে? So this is forming the apex. So now see, this is the picture. So already I have discussed. ভালো করে বোনগুলো দেখে নে. What is this bone? This is the frontal orbital plate of frontal. Orbital plate already you have seen while you have studied the anterior cranial fossa. তাই না? দুটো সাইডে যেখানে ফ্রন্টাল লোব, অরবিটাল লোব অফ ফ্রন্টাল লোব থাকে, so there is a situation of orbital plate. Okay, and what is this foramen? This is the supraorbital notch. এটা পুরোপুরি জয়েন করে যায়, it is making one foramen. ঠিক আছে? So lateral side এ which are the bone? Frontal bone খানিকটা আসছে. What is this suture? This is the frontozygomatic suture. এটা পুরোটাই হচ্ছে zygomatic. Okay, and what is the inferior wall is formed? Part of zygomatic and mainly by the maxilla. Okay, orbital surface of maxilla. Medial wall টা ভীষণ ইম্পর্টেন্ট। সো মিডিয়াল ওয়ার্ল্ডে প্রথমে কি পাচ্ছিস? ফার্স্ট ওয়ান ইজ দ্য ল্যাক্রিমাল বোন, দেখতে পেয়েছিস? দিস ইজ দ্য ল্যাক্রিমাল বোন। নেক্সট ওয়ান ইজ দ্য অরবিটাল প্লেট অফ ethmoid. দিস বোন ইজ এ পেপার থিন। ওকে, ইট ইজ নোন অ্যাজ ল্যামিনা প্যাপ্রিওসা। ঠিক আছে, ল্যামিনা প্যাপ্রিওসা। অ্যান্ড ইফ ইউ সি দিস টু foramen, there are two foramen, anterior and posterior ethmoidal foramen. ওকে, এটা কি ট্রান্সমিট করে? অ্যান্টিরিয়র অ্যান্ড পোস্টেরিয়র এথময়েডাল নার্ভ অ্যান্ড ভেসেলস। ওকে, and if you see over there, this is the greater wing of sphenoid and this is the lesser wing of sphenoid. Lesser wing টা উপরে থাকবে, greater wing টা নিচে থাকবে। Okay, so it will form the superior orbital fissure. Now tell me how the inferior orbital fissure is formed. Which bones? Superiorly কে থাকছে? sphenoid, part of zygomatic, part of the maxilla. Okay, all things are coming. Okay, now one thing, write it down. What are the different connection with the orbital cavity? Connection of orbital cavity. তিনটে connection আছে। Okay, connection of the orbital cavity. Number one is optic canal. একটা দিকে রোতে লেক optic canal. So এটা কার সাথে connected? To the middle cranial fossa. Optic canal to the connected to the middle cranial fossa. Okay. Then next one is the inferior orbital fissure. Next one is the inferior orbital fissure. Where does it connected? এটা যদি inferior orbital fissure হয় কার সাথে connected হতে পারে? এই পার্টটা কি? This is the temporal bone. Okay, just below that this is the temporal bone. এর নিচে যে পার্টটা পাবে ম্যান্ডিবলে সেটাকে কি বলবো? ইনফ্রাটেম্পোরাল। Okay, so write it down. It is connected to temporal and infratemporal fossa. ভীষণ important, so many structures are there. Okay, so inferior orbital fissure থেকে কার সাথে connected হচ্ছে? একটা হচ্ছে temporal and infratemporal fossa. Infratemporal fossa. And next one is, write it down, these two foramina, anterior and posterior ethmoidal foramina. Where does it connect? কোথায় কানেক্ট হবে একটু বল। পড়েছিস অলরেডি। বেস অফ দ্য স্কালের কোন ক্রেনিয়াল ফসায় হবে? Obviously it won't go to the posterior, anterior cranial fossa. Anterior cranial fossa যেখানে ক্রিস্টা গ্যালাই দেখেছিস, যেখানে cribriform plate of ethmoid দেখেছিস, just beside that there are two foramen. These two foramen will open over there. ঠিক আছে, anterior and posterior ethmoidal nerve and vessels. Okay, so these three connection are frequently asked. Okay, এইটা দেখ, this is the optic canal. Optic canal দিয়ে কি যায় বললাম? Optic nerve and the ophthalmic artery. But remember, it will go along with meninges. কোন লেয়ারটা? endosteal layer of meninges. And optic nerve actually acting like a brain parenchyma. ঠিক আছে, এটা কিন্তু একটা ইম্পর্টেন্ট জিনিস। So next one is, see, this is the diagram. So what are the thing you could see? This is the superior orbital fissure, optic canal. This is the inferior orbital fissure. এবার বুঝতে পারছিস how it will be connected to the temporal and infratemporal fossa, দুটোর সাথে connected হবে। Okay, so this is the orbital surface of maxilla. কাদেরকে সারফেস বলবো? Orbital surface of zygomatic, orbital surface of maxilla. These are all surfaces. And which is the most smallest part? See this P, যেটা সব থেকে ছোট দেখতে পাচ্ছিস সেটা হচ্ছে প্যালাটাইন। ওকে, সব থেকে স্মলেস্ট পার্ট। ওকে, সো প্যালাটাইনের কোন পার্ট? অরবিটাল প্রসেস অফ প্যালাটাইন। অরবিটাল প্রসেস অফ প্যালাটাইন। ওকে, আরেকটা ইম্পর্টেন্ট থিং ইজ, ওয়্যার ইউ আর সিইং দিস অরবিটাল প্লেট, স্কোয়ার শেপ এথময়েড, জাস্ট পোস্টেরিয়র দ্যাট, কেন এখানে ইট ইজ অলরেডি ব্রোকেন? It is paper thin. Why? Because just posterior to that there is a situation of ethmoidal air sinus. Okay, there is a situation of ethmoidal air sinus. Okay, so now they have told everything I have discussed. Okay, how you have, suppose orbital cavity came, so you have to tell everything about the boundaries, then you have to tell the apex, then base, then floor. This thing you have to explain. Okay, how does it form? Now write it down. What are the features? Features of the medial wall. শুধু এই তিনটে লিখবি, লাস্টের তিনটে। Okay, features of medial wall. First one is the lacrimal fossa. Lacrimal fossa. So how the lacrimal fossa is formed? What are the content of lacrimal fossa? Just now I said ল্যাক্রিমাল গ্ল্যান্ড হবে না ল্যাক্রিমাল স্যাক হবে? ল্যাক্রিমাল স্যাক হবে। ওকে, হোয়াট ইজ দ্য কন্টেন্ট অফ ল্যাক্রিমাল ফসা? ল্যাক্রিমাল স্যাক। হাউ ইট ইজ প্রডিউসড? দুটো ক্রেস্ট থাকে, একটা হচ্ছে অ্যান্টেরিয়ার ল্যাক্রিমাল ক্রেস্ট, পোস্টেরিয়ার ল্যাক্রিমাল ক্রেস্ট। ইট উইল ফর্ম দ্য ল্যাক্রিমাল ফসা, যার মধ্যে ল্যাক্রিমাল স্যাক থাকে। ওকে, so this thing only they have told. Okay, and these two foramina you have to mention, that is anterior and posterior ethmoidal foramina. Okay, so see, this is the anterior and posterior ethmoidal foramina, this part. Okay, and this is the optic canal, and here on the floor you could also see the maxillary air sinus. পুরোটাই কিন্তু সাইনাস থাকবে, এখানে থাকবে ethmoidal sinus, স্পেনোয়েডের পিছনে স্পেনোয়েডাল সাইনাস, ইনফিরিয়রলি ম্যাক্সিলারি সাইনাস। ওকে, সো নাও দ্য ল্যাটারাল ওয়াল। সো ল্যাটারাল ওয়াল, হোয়াট আর দ্য থিংস আর অ্যাটাচড? শুধু অ্যাটাচমেন্টটা লিখবি। ল্যাটারাল ওয়াল, হোয়াট আর দ্য থিংস আর অ্যাটাচড? এই দুটো নার্ভ কার ব্রাঞ্চ বলতে পারবি? জাইগোমেটিকো ফেসিয়াল, জাইগোমেটিকো টেম্পোরাল। জাইগোমেটিক নার্ভ না ফেসিয়াল? ফেসিয়াল নার্ভের ব্রাঞ্চ। হ্যাঁ, কারেক্ট কারেক্ট। জাইগোমেটিক ব্রাঞ্চে দুটো ব্রাঞ্চ, জাইগোমেটিকো ফেসিয়াল, জাইগোমেটিকো টেম্পোরাল। একটা পুরো ফেসের সাইডে থাকছে, একটা উপরে ফোরহেডে চলে যাচ্ছে। ওকে, সো নাও রাইট ইট ডাউন, দিস ওয়ান, দিস টু নার্ভ, জাইগোমেটিকো ফেসিয়াল, জাইগোমেটিকো টেম্পোরাল, and it will open by two different foramina, zygomatico temporal, zygomatico facial. Okay, next one is very much important for your MCQs, Whitnall's tubercle. Whitnall's tubercle, এটা কোন সাইডে থাকে অলরেডি আমি বললাম, lateral সাইডে। Okay, you have to trace the frontozygomatic suture. So if you trace on the inferior side, you will get one projection, so that is known as Whitnall's tubercle. So it's a small bony tubercle located just behind the orbital margin, just below the frontozygomatic suture. Okay, so what are the attachment? Write it down. There are three attachment. Ki ache? First one is lateral rectus. Lateral rectus to thik, but there is one thing that is known as check ligament. What is check ligament? There are two rectus, medial rectus, lateral rectus. How does it attach to the eyeball? যদিও এটার নাম চেক, but how does it will look? It will look a triangle, triangular insertion. ঠিক আছে, মিডিয়ালি কি থাকবে? মিডিয়াল চেক লিগামেন্ট, ল্যাটারালি থাকবে lateral check ligament. Okay, so you have to mention this one, check ligament of lateral rectus. Okay, and then the last one is suspensory ligament of eyeball. Do you know? Vishon important, suspensory ligament of eyeball. This is also known as ligament of Lockwood. Okay, ligament of Lockwood. Where it is present? Now tell me, inferior surface e ki muscle thakbe? Inferior surface e boundary te which are the muscle of eyeball? Inferior rectus thakbe, arekta thakbe tor inferior oblique. Okay, so these two muscle has got one suspension ligament. Okay, suspensory ligament which is hanging these two muscle. Okay, so what is the function of this suspensory ligament? Write it down. এখানে একটা clinical anatomy আছে. If suppose any injury to the face, okay, injury to the face, external injury to the face, the eye is not sagging down. Suppose maxilla has been injured, but the eyeball is not sagging down. Why? Because the suspensory ligament of Lockwood. Okay, I will show you the picture. So the eye would be remain intact on the this boundary. Okay, it won't sag down. Now write it down. About the roof, roof e ki pabi? First one is the fossa for the lacrimal gland. কোথায় থাকবে? anterolateral, এই পোরশনে থাকবে। ঠিক আছে, lacrimal gland. Next one is the trochlear notch or spine. So it is found on the anteromedial ankle of roof. Already I told you which thing would be attached? Pulley for the superior oblique. It will have pulley for the superior oblique muscle. Okay, anteromedial e thakbe. Anterolateral e ki ache? Lacrimal gland. Medial e ache trochlear. Then next one is the optic canal. Okay, so it is extreme posterior part covered with meninges. it will transmit optic nerve and the ophthalmic artery. Okay. Now next one is the floor. Floor e ektai jinish pabe, infraorbital groove. Have you seen this groove in maxilla? Maxilla te amra dekhechi there is a situation of one groove. Okay, then it is coming out as a foramen. Okay, so there you will get this one. So another thing is, where is the origin of inferior oblique? Where is the origin of inferior oblique? It is just lateral to, write it down, inferior oblique has been originated from just lateral to the nasolacrimal canal, just lateral to the nasolacrimal canal. Okay, so this thing already I have told you. Okay, base ki pabi. Okay, the infratemporal fossa, how it is connected to the alveolar fossa. Okay, so that thing you have to know. Now just write it down about the axis. There are two axes that you have to know. Duto axis thake, how you will know? First one is the visual axis. Suppose anything you are seeing, how it will transmit? How it is transmitted as a ray? First it will, where it will make the impression? Cornea, তাই তো cornea থাকবে, তারপরে কি কাকে pierce করবে? Sclera. Okay, inside, then where it will go? Rods and cones in the retina. Okay, so if it is going vertically যেটা যাচ্ছে সেটা হচ্ছে কি visual axis. Okay, and another one is orbital axis. What is orbital axis? It will pass through the base of orbit. আমি বললাম বেসটা কি, টোটাল ক্যাভিটিটা, এপেক্সটা কোথায়? At the center. Okay, so if you just draw a line, vertical line from the middle of base to the apex, so that is known as orbital axis. Just write it down. Angle between এই লাইনটা ভীষণ ইম্পর্টেন্ট, angle between visual and orbital axis is about 20 to 25 degree. Okay, arekta ache orbital index, so that is maximum orbital height divided by maximum orbital breadth into 100. Okay, so that is important for any surgery, anthropology and also the forensic medicine. Okay, now what are the different fossa? Okay, so which fossa you have to remember? First one is the periorbital fossa. Just write it down, 4 names. First one is the periorbital fossa is divided into 4 types. Number 1 is orbital septum. Orbital septum, you could see what is the origin from the both side. Okay, then next one is we are having the orbital fossa. Orbital fossa arekta ki naam? If you see the orbital fossa, it is continuing where? To the optic nerve. Even it is going to the meninges. Okay. Then the third one is optic fossa. Arekta naam hoche lacrimal fossa. Third one is the Tenon capsule. Just write it down. This one very important. Bulbar fossa, Tenon capsule. What is that? This is the inner layer of orbital fossa. In the orbit that forms the facial sheath of eyeball. Okay, তার মানে এটা completely দেখ কভার করছে except এই পার্টটা, কর্নিয়া ছাড়া, except the cornea. এই গ্রিন কালারটা হচ্ছে টেনন fossa. Okay, টেনন fossa or Tenon capsule. So write it down, which are the structure that are piercing the Tenon capsule. Structure piercing the Tenon capsules are: number 1, tendon of extraocular muscle. Number 2 is ciliary vessels and nerve. Ciliary vessels and nerve. Okay, and the third one is the optic nerve. Optic nerve ke pierce kore jete hobe, right? So this is the three structure. Okay. আচ্ছা এখানে আরেকটা লিখে রাখ ল্যাক্রিমাল ফাসা অ্যাটাচমেন্ট টু দুটো অ্যাটাচমেন্ট দেয় মিডিয়াল প্যালপেব্রাল লিগামেন্ট and lacrimal part of orbicularis oculi. Orbicularis oculi muscle has got how many part? Orbicularis oculi কটা part? Facial muscle. এখানে যেটা থাকে না দুটো পার্ট না কি কি পার্ট বল? একটা প্যালপেব্রাল পার্ট একটা বালবার পার্ট তাই তো একটা মাসল কি থাকে পুরো এখানে কর্নারে এরকম করে লুপ করে করে আসে সো দ্যাট ইজ ওয়্যার দ্য মিডিয়াল প্যালপেব্রাল লিগামেন্ট ওকে হোল্ড করে করে আসে ওকে সো দেয়ার ইজ দ্য অ্যাটাচমেন্ট অফ ল্যাক্রিমাল ফসা ওভার দেয়ার ওকে অফ দি অরবিকুলারিস অকিউলি then what are the other thing you have to see next one is orbital muscle next one is the orbital muscle orbital septum okay so write it down which one is the episcleral space which one is the episcleral space so it separate the tenon capsule from the sclera just write it down this one what is episcleral space it will separate tenon capsule from the sclera okay or medial cheek ligament lateral cheek ligament I have told you and the last one is the suspensory ligament of the lock hood okay so see this is the suspensory ligament dekhte pachchis so what are the attachment you could see what is this medial rectus this one is the lateral rectus আর এখানে কি কি আছে inferior rectus inferior oblique পুরো সাসপেনশন করে আছে আইটাকে ওকে সো সাপোজ এই ম্যাক্সিলাটা যদি ফ্র্যাকচার হয় the eye won't sag down okay এটা বারবার ক্লিনিক্যাল কোশ্চেন দেয় eye would be intact it's so delicate structure okay so it would be always provided the support okay so this is the suspensory ligament of lock hood okay see this is another attachment key Whitnall's tubercle okay and this is the medial cheek ligament lateral cheek ligament so these are the muscle already you know okay additionally you write what are the muscle you have to also include the levator palpebrae superioris okay along with the 6 extraocular muscle so what are the other muscle see if you want to discuss last bench you may go out you are skipping yourself I have crossed everything I have passed nothing to worry you have to pass okay so see what are the other muscle write it down superior tarsal or Muller's muscle কাকে বলে superior tarsal দুটো টার্সাল মাসল থাকে superior tarsal inferior tarsal superior tarsal muscle is also known as Muller's muscle okay another one is inferior tarsal muscle so see these are the different muscle so what you could see these are the superior oblique তাহলে এই যে bony projection টা এটাকে কি বলছে trochlea see how it is hanged over there okay so this is the inferior oblique these are the all rectus muscle so tell me about the function extraocular muscle এর কি কি function except the levator palpebrae superioris LPS এর কি কাজ elevate the upper eyelid so remaining all are the extraocular muscle so superior rectus what is the function elevation হবে না depression হবে এলিভেশন হবে অবলিকটা কি হবে ডিপ্রেশন হবে ঠিক আছে এখানে অলরেডি ওরা বলেছে So they have told about the Horner syndrome. See, Horner syndrome, how does it produce? It will produce by superior tarsal muscle. এটা ভীষণ ইম্পর্টেন্ট। superior tarsal muscle টা কি? Muller's muscle। ঠিক আছে, তাহলে এমসিকিউ আসতে পারে superior tarsal muscle মানে হচ্ছে Muller's muscle। ওকে, then next one is the inferior tarsal muscle, so it depresses the lower eyelid, and then next one হচ্ছে orbitalis। ওকে, so এখানে একটা ইম্পর্টেন্ট জিনিস হচ্ছে whatever the rectus, they are coming from where? The tendinous ring of Zinn। okay, the ring is attached to the medial part of superior orbital fissure। একটু লিখে নে, Zinn is attached to the middle part of superior orbital fissure। okay, so lateral rectus have got two head, one head is from the tendinous ring and another one is from the greater wing of sphenoid, greater wing of sphenoid। so এখানে একটা দিতে পারে লিম্বাস থেকে কার কত ডিসটেন্স। ওকে, ইফ ইউ কুড রিমেম্বার দ্যাট ইজ ওকে। সো মোর ডিসটেন্স কার দেখতে পাচ্ছি? সুপিরিয়ার রেক্টাস। লিম্বাসটা কোনটা? হুইচ ওয়ান ইজ দ্য লিম্বাস? Limbus would be produced over here, right, at the middle or center। the center থেকে কার কত ডিসটেন্স? superior এর ডিসটেন্স সবথেকে বেশি। ঠিক আছে, lateral আরো বেশি, inferior আরো কম, medial আরো কম। so it's not that much important। so see, these are the oblique muscle, so this is the limbus, this is the distance। okay, LPS already আমরা করেছি in case of face, ফেসেও পড়া হয়েছে। so I'm just skipping this slide। now this one is important, make a snapshot this one। okay, action of the extraocular muscle। okay, elevation, adduction, intorsion। intorsion মানে কি রে? intorsion, internal rotation, and extorsion means outward rotation। so these are the all extraocular muscle। আচ্ছা, এবার আমাকে একটা ইন্টারেস্টিং জিনিস বল, যদি oculomotor nerve is paralyzed, suppose oculomotor nerve is paralyzed, okay, that too I am giving you hint to the right eye। okay, tell me the position of eyeball। কোনটা ইনট্যাক্ট থাকবে? কার ফাংশন ইনট্যাক্ট থাকবে? সুপিরিয়র ওবলিক আর ল্যাটারাল রেক্টাস। তাহলে কি রকম হবে আইটা? অ্যাবডাকশন হবে না অ্যাডাকশন হবে? বি ক্লিয়ার। অ্যাবডাকশন হবে, কারণ ল্যাটারাল রেক্টাস ইজ ইনট্যাক্ট। okay, now suppose abducens nerve is paralyzed, what will happen? the eye would be adducted। okay, so this thing you have to remember। okay, so see, these are the different movement they have shown। okay, different movement of eye। so they are the conjugate movement। so conjugate movement কার কার হবে? একসাথে কোন কোন মাসল কাজ করতে পারে? সুপিরিয়র রেক্টাসের সাথে ইনফিরিয়র ওবলিক, আর ইনফিরিয়র ওবলিকের সাথে সুপিরিয়র রেক্টাস, এইভাবেই হবে। ঠিক আছে, সো দিস ইজ দে হ্যাভ শোন দ্য ডিফারেন্ট টাইপ অফ ডিজিজেস। একটা তোরা জানিস স্ট্র্যাবিসমাস। ওকে, স্ট্র্যাবিসমাস ও স্কুইন, ডেভিয়েশন হবে এক সাইডে, ডিপ্লোপিয়া মানে কি ডাবল ভিশন। ওকে, অ্যান্ড another thing, see, paralysis of lateral rectus। এটা একটু লিখে নে, paralysis of lateral rectus হলে কি হবে? result in esotropia, esotropia, esotropia or medial squint। ডিপ্লোপিয়া কোন দিকে দেখা যাবে? টু দ্য প্যারালাইজ সাইড, যেদিকে প্যারালাইসিস হয়েছে ওই সাইডে দেখা যাবে। ওকে, আর মিডিয়াল রেক্টাস হলে কি হবে? এক্সট্রোপিয়া। এটা হচ্ছে এসোট্রোপিয়া, এটা হচ্ছে এক্সোট্রোপিয়া। ওকে, বোথ আর ডিফারেন্ট। এসো আর এটা হচ্ছে এক্সো। both are different. Okay, nystagmus already I told. nystagmus কেন হয়? nystagmus মানে কি? horizontal oscillatory movement of the eyeball, both side, like a pendulum of a clock. Why it is happening? disorder of ব্রেনের কোন পার্টে ডিসঅর্ডার হলে হবে? সেরিবেলাম, রাইট? সেরিবেলামের কোন পার্টটা? ফ্লকিউলো-নডুলার লোব। ওকে, ফ্লকিউলো-নডুলার লোব। nystagmus হবে, ভার্টিগো হবে, রাইট? সো দিস আর দ্য থিং, another thing is nystagmus. আচ্ছা, এখানে একটা টার্ম বলছে, প্রিভিয়াস কনসেপ্ট বলছিল যে মিডিয়াল স্কুইন্ট আর ইন্টারনাল স্ট্র্যাবিসমাস। ওকে, আর ল্যাটারাল স্কুইন্ট মানে হচ্ছে এক্সটার্নাল স্ট্র্যাবিসমাস। এটা এখন ইউজ করা হয় না। এক্সটার্নাল ইন্টারনাল বলবো না, কি বলবো? একটা হচ্ছে এসোট্রোপিয়া, এসোট্রোপিয়া মানে মিডিয়াল, আর আরেকটা হচ্ছে এক্সোট্রোপিয়া মিন্স ল্যাটারাল। ওকে, সো দিস আর দ্য টু ডিজিজেস অফ আই। ঠিক আছে, so that is all about the eyeball. I will take another class, okay, for oculomotor nerve and different nerves. It is too long chapter to complete.